Commissioner, we're going to gavel in just a second. If you want to go ahead and be coming to the table and getting settled in, that way we'll be ready to go. We're waiting on a couple more members to come and we'll get started. All right, I'd like to call the Finance, Ways and Means Committee back to order for February the 25th, 2026. And the next budget hearing is by the Department of Mental Health and Substance Abuse. So without objection, we will go out of session. We're out of session. And members, just a reminder that all the materials are on the dashboard. And also, just like to let our presenters know that just wait till you see the red light come on. We will actually control those up here. And if you would begin, Commissioner, just introducing yourself and who you have with you. Thank you for being here and sorry for the delay.
No problem. Thank you so much. Good afternoon, Chairman Hicks, Vice Chair Gillespie, and distinguished members of this House Finance, Ways and Means Committee. It is such an honor to be with you to present Governor Lee's proposed budget for our department. Yours and Governor Lee's support has meant the world to the Tennesseans we serve, as well as the leaders and teams from community providers, consumer, family, and faith-based organizations across this state, many of whom are in the audience today, and some are watching online out of state. They've sent me pictures showing their watch party. At the table with me is Budget Director Justine Bass to my left. To her left is Deputy Commissioner Matt Yancey. And then to my right is Chief of Hospital Operations Ty Thornton. Our mission as a department is all about creating collaborative pathways to resiliency, recovery, and independence. Some of those headline achievements from your investments with outcomes are as follows, and I will go through these briefly. First, thanks to your support, if you look at this slide, the efforts of many community behavioral health providers across the state, our hospital, our regional overdose prevention specialist, Lifeliners, Tennessee Recovery Navigators, and prevention communities. We are seeing the tide turn. You will note that overdose data is showing that it's going down, more than 30% decrease. Next slide focuses on Project Rural Recovery. In the audience, we have members from Buffalo Valley, McNabb Center, Ridgeview, and Pathways. This went from a dream to reality when Governor Lee took office and he focused on rural communities. We are now at 20 rural communities being served with more than 6,600 rural Tennesseans having received behavioral health and physical health care. I want you to know that there have been more than 19,000 patient visits since this began. In our audience is Director Jessica Youngbloom, who has done a fantastic job working with our community providers to get this up and going. One outcome you'll like, more than 40% said that they would not have seen anyone and haven't seen anyone in more than 5 years. So this helps with prevention and intervention. Next, you'll note that those that have those in their communities are Chairman Hicks and Chairman Faison and Representative Capley, Gant, Representative Shaw, and Moody. So I want you to know we are in your community serving people. The next slide shows the funding you gave us to take the criminal justice liaison statewide. So we have a criminal justice liaison in every jail with every sheriff. I cannot say enough about that. Again, our providers in the audience and online are the ones that do this service day in and day out. They have served more than 16,000 Tennesseans. If you look on the picture, this man is Zach. He resides in Chair Williams' district in Cookeville, and we're very excited about the services he's getting. Slide 5, we're grateful for the incredible progress in addressing the ongoing issues of vacancy and turnover across our community behavioral health system. Deputy Commissioner Yancey led multiple work groups, and we came up with the Pathways Behavioral Health Scholarship Program. You'll see Donna on here. She has graduated, and she's along with over 100 who have graduated, and 66 of those are now working in the Community Behavioral Health Provider Network. By the time this is over, we will have over 400 in our communities, done in a very short time because you funded this. This last slide, slide 6, focuses on what you have done to make sure our precious children that struggle with substance misuse and their families struggling with serious emotional disturbance across this state could thrive. Based Behavioral Health Liaison Program has given them hope. You'll see Dominique right there on the slide. She's an amazing support for young people in her community. Representative Shaw in Jackson Pathways area, not only through her education and skill at the job, but she also has the heart and background and experience to help these kids. Slide 7, I go over this in detail. I do this every year where I show you the gap, but you will note that we have 2 slides that talk about the gap, which leads me to our cost increase request that we'll turn to. For 27, we're asking for $3 million recurring to expand our school-based behavioral health liaison program. This funding will come from the K through 12 Mental Health Trust Fund and will allow us to add up to 43 new liaisons. Our second cost increase is $5 million non-recurring for the Creating Homes Initiative. This would specifically fund the Creating Homes Initiative 3.0 program, which provides supportive housing for people returning to communities after incarceration, living with mental illness, and substance use issues. This would allow us to expand by 100 new permanent housing beds. Our third is $2,107,600 non-recurring for the Addiction Recovery Program. This continues non-recurring investments from previous years to support the Addiction Recovery Program, which, as you know, includes services for transitional housing, relapse prevention skills, transportation, and parent education. Our fourth is $3.8 million in non-recurring funds for our Project Rural Recovery Program. This would allow us to sustain the 4 mobile projects that I just went over, as well as allow us to add 2 more clinic units for a total of 30 rural counties being served. Item 5 is $1.775 million non-recurring funding for our Tennessee Pathways Behavioral Health Scholarship. This will be our last year that we will request any money for that. Why? because we met the need. If this gets funded, we have met the gap that we came here and talked to you about a little over 2.5 years ago. Item 6 in our proposal is $2 million for substance use disorder treatment. This continues the non-recurring investments from previous years to fund additional capacity and access to treatment and recovery services. This funding would come from TennCare shared savings. Item 7 in our proposal is $1 million for the community mental health workforce development. This is also from TennCare savings, and it's a continuation of last year. It would allow us to continue support for supervision for clinicians that are trying to get a higher level licensure and counseling license. Item 8, an amount of $5.1 million, which supports addiction treatment services. Item 9 is $4 million for K-12 Mental Health Trust Fund grants. This item is funded from the K-12 Mental Health Trust Fund. It would allow us to support community grants to enhance community behavioral health providers. Item 10 is recurring and state funds to support the next door, $500,000 there. Item 11 is $500,000 to support Jason Foundation in recurring state dollars. They are in the audience. And item 12 is $250,000 recurring in state funds to support Families Free, also in the audience, to provide treatment, education, and intervention services to families. In closing, Chairman Hicks, Vice Chair Gillespie, and committee members, this is the quickest I've ever done any kind of budget presentation in my whole career. We know this is a tight year, and we know that you have a bunch of proposals that you're looking at, but we believe and we stand ready with our behavioral health providers, our consumer, family, faith-based organizations, and our hospital teams that work tirelessly 24/7 for those that are in need of inpatient hospitalization to take additional strides toward our vision of seeing all Tennesseans living with behavioral health challenges thriving. When they thrive, their families thrive, their businesses thrive, their communities thrive. With that, we stand ready to answer any questions that you might have.
Thank you, Commissioner. You have the co-pilot now for a little bit, but
Okay.
we have several questions on. The first I'm going to start with, though, is Leader Lambert. Leader Lambert, you're recognized.
Commissioner, thank you. And Commissioner, thank you for you and your staff for the tour of MTMHI a few weeks ago.
Yes,
That
sir.
was very helpful. I would encourage any members to tour through the facilities that the commissioner oversees and meet the patients that are being cared there. They're wonderful folks that suffer from pretty tough stuff, but wonderful folks, and really enjoyed meeting them, a couple of them particularly. And so Jillian's Law, obviously the chairman and his leadership and myself and others have passed that. We've passed other bills that have tried to make sure that we have a better set of laws there so that folks get the help that they need before they hurt themselves or somebody else. My question is, how many individuals at this point have been sent to a state-run inpatient facility due to that legislation specifically on Jillian's Law?
Yes, sir. I so appreciate you asking this question. I also want to say, y'all, Leader was a celebrity when he came to Middle Tennessee Mental Health Institute. One of our patients had seen him on TV, and so she came running up to him and said, "I know you. I know you. I saw you on TV." And I know he thinks we planted that person, but we did not.
She was very sweet.
Okay,
but-
so here we go. We have 166 that were sent last year, and we are projecting for FY 2026, 200.
And Commissioner, where were those numbers 2 years ago? Where were those patients 2 years ago?
Yes, sir. So in FY 2024, we had 130 forensic patients. And then, of course, you know, there were many outside of that that were not referred because Jillian's Law was not in existence. And Chief of Hospital Operations Ty Thornton and myself very much support this law. It is helping people that were falling through the cracks to be able to get connected to services. And we know that when you get connected, you can get into recovery and totally turn your life around. So we're grateful for the opportunity to do this.
Well, thank you, Commissioner. And obviously, the need is there. The numbers show that. And we collectively made a dedication to you all that If for some reason the facilities were not able to handle the number of patients, because not having this on the books before, we didn't know how many patients were out there. They were languishing in jails or just being released. So where are you as far as capacity? How many beds are being utilized now, and how many are potentially needed, if any, at this juncture?
Yes, sir. We really appreciate you asking that. We've been keeping our census at Middle Tennessee. We're right at 100% census. At Western Mental Health Institute, right at 95%. Memphis Mental Health Institute ranging from 80 to 85%. And then Western Mental Health Institute, we have the highest census that we've had in over, I would say, 5 to 6 years. So where we're at is we're able to serve the people right now. And we're doing our best with that. We do have a waiting list. We talked to you about that. And we are doing better than other states. Ty and his team did a review to see where we are related to wait times, but we still don't want to turn into what other states are doing with wait times. I hope that answers your question.
It does, but keying that up, and the chairman and I very much so would like a public answer on this. I know you've told us both this privately, but when we talk about wait times on an individual that has been charged with a crime and many times is waiting in a local jail, well, let me ask it this way. How long does it take for someone from the time they're referred over to get that evaluation? And where primarily are they waiting for that evaluation?
Yes, sir. I've got that answer right here. So if you look at Middle Tennessee Mental Health Institute, it right now is approximately 98 days after receiving the court order to do what we need to do. At Moccasin Bend, it's right at 112 days. Again, we're still doing better than surrounding states. When you look at them, Texas, for example, Kentucky are ranging around 445 days to wait. Mississippi's at 287 days. Louisiana, 180. Again, we're at the lowest group as far as our wait time. But the only reason we're there is that we currently are having the bed capacity. So we know, and we've talked about this, that we're going to need to expand beds to be able to serve the people that are waiting.
Well, Commissioner, I don't mind saying this. I mean, 90 to 120 day wait, a 3 to 4 month wait may be below where other states are, but it's definitely not anywhere near where we'd like to be. I mean, ideally, and I know this is kind of a gaudy request. I mean, I personally would love to see that at more like 30 days or less, because if someone's in jail and they're charged with a crime, and we know there's a high likelihood that they need your services, why on earth would we want them to stay in a local jail when they could be in a secure facility, getting the treatment they need, potentially becoming competent to stand trial for their charges, and if not, retained in a facility where they can get the care they need instead of a jail. So with that in mind, how many beds in the state currently are unstaffed? So beds that you have physically that exist, where the physical structure's there, you don't have to build a thing, but how many unstaffed beds do you have?
Yes, you and I spoke about that. When you look at our hospitals, for instance, Memphis Mental Health Institute, we put in a proposal to add on 25 more beds. I think we could go up to 50 beds there. Is that correct, Ty? Awesome. And then when you look at Middle Tennessee, we added 25 beds already from last year. You guys funded that. We have the capacity to add more beds at Middle Tennessee Mental Health Institute, but would have to sort of change our programming. Then when you look at Moccasin Bend, we're very hopeful that we're going to find a location within the next 2 months. We're onto something that we think is going to pan out, be able to build there. And then, of course, when you look at Bolivar, there's areas there that we could build.
Well, if you combined all of those, I mean, do you have a total number of, again, physical beds that are available, but literally just need the funds to staff them?
Yeah, and the physical beds are not up. There are units that we could do. Chief, do you know how many we could do in the units?
Yes, ma'am. So
It's on.
Okay. So we are licensed for a total of 763 beds across our 4 regional mental health institutes. With the latest expansion of 25 beds at MTMHI, we currently have a total of 602 in operation. So that would leave 161 that we are licensed for, but not set up to operate.
And approximately what would it cost to fully staff those 161?
Yes, sir. For a 25-bed unit, it's right at $5 million. So if you did 25 into this, you're looking at 6 times 5. I'd say under $40 million.
So, and approximately for every 5 million that we invest, it's going to cover about 25 more staffed beds.
Yes, sir.
Okay. Chairman, those are my question. And I know Chairman Williams has been intricately involved in not only championing these issues, but meeting with these families that have been negatively affected by those that suffer from severe mental health issues that have been released back into the community. I hope that we will all consider that as we go through the budget journey. 3 to 4 months wait for mental health evaluation. And again, y'all are doing the best that you can with the funds that you have. But I have a very dear friend of mine that tells me on a regular basis, if you have a problem that money can solve, you don't really have a problem. The biggest problems in this world are ones that no amount of money could solve. To invest $5 million for 25 more beds and however many tranches that we could do of that is simply going to decrease your wait time for evaluation and increase the number of people you can help, correct?
Yes, sir.
All right. Thank you. Thank you, Chairman.
All right, thank you. I've got a quick question about the K through 12 Mental Health Trust Fund. So the proposed budget includes 4 million non-recurring from the Mental Health Trust Fund.
Yes, sir.
So I guess that gets us up to 12 million. Has that full 12 million been expended that was previously appropriated?
So we have different pots, non-recurring and recurring.
Okay.
All of the recurring is expended. It's allocated. It's out there. We currently are doing an announcement of funding for small, is it 2 million, 3 million? What is the AOF, Deputy Commissioner?
Yes, ma'am. It's for infrastructure grants for local communities, local schools to create environments there in the school setting that are more conducive to school-based mental health services. As the commissioner said, we just released an announcement of funding for this year's allocation in non-recurring dollars. We look to fund, I think it's around 21 projects among 16 applicants. So those dollars are in the process of being obligated for this fiscal year.
Okay, so dive a little deeper to what we're using it for. I know you just hit the 30,000 flyover. Get in the weeds. How is this helping? How are we moving the needle, and what do we need to do to continue? Of course, working through in that K through 12 space, I see it each and every day when I'm back in the district because, I mean, it's right in front of me when I'm sitting in my office. So how is this trust fund going to help us move the needle, and what are we doing right now?
I think that's a great question. As someone who used to work in a school district, I can tell you that when it comes to mental health services being provided in that environment, unless there is a defined, dedicated space for counselors and therapists and social workers to work in, it's really hard for students to receive mental health services in the school. So, Chairman, to your question specifically, these dollars have helped retrofit, renovate unused classroom spaces to become counseling offices, small group therapy rooms. Providers have used these funds to purchase telehealth equipment, which we know is really important. Calming rooms, providers and schools have also used these dollars to support electronic record systems to ensure better communication between the school and the provider. And also, there have been items related to safety infrastructure, crisis response, and also training. This is one of the parts of this grant is to really help educators and schools be better equipped, better trained to support students dealing with mental health issues. So we have been fortunate to use these dollars to also support training in local schools across the state.
All right, thank you very much. Have a couple more folks on the list. Let's go to Chairman Hogg. Chairman Hogg, you recognize.
Thank you. Thank you, Mr. Chairman. Commissioner, thank you. With your indulgence, and Chairman, I mentioned in our morning session that Representative Renee Jones could have a grandbaby any day. She has a grandbaby, baby girl, 5 pounds, 12 ounces, 35 weeks into the pregnancy.
Wow.
She is now a grandmother for the third time. Congratulations,
All right.
Renee. And I do want to expand a little bit about what Chairman Hicks was talking about. And I want to give a pat on the back to this committee and the administration as well. The responsible budgeting that we've done over the last 5 years has created the Mental Health Trust Fund, the shared savings fund that we've seen in your presentation as well. And thank you for that. And thank you to the committee and the work that's been done by the administration and the legislature over the last few years to create those where we're heading in a better direction. I want to talk a little bit about the people part of the K-12 Mental Health Trust Fund. We've talked about getting rooms together and safe spaces and things like that. we want to have the goal is to have a liaison in every school building. We're talking around
Yes, sir.
1,800 buildings.
Yes, sir.
The proposed budget, we've got 3 million that you mentioned. I think you said 43,
Up to 43.
up to 43 liaisons. Tell me, have all the prior liaison positions been filled that we have budgeted previously? And where are we now in terms of meeting that goal of being in all 1,800 school buildings?
I really appreciate you asking that. In the audience is Assistant Commissioner Beth Goodner, if you don't mind waving your hand. She's done an unbelievable job with her team. We're up to almost 400 liaisons, right around 391. We range from 85% filled to 87% filled out of what is actually allocated. We would love to have one in every school. If we can have one SRO in every school, it's my hope that we can have one liaison in every school.
Chairman Hall?
Thank you. And it's not going away. We've talked about AI for just about every meeting we have and every department that comes before us. My 14-year-old, I'm concerned about where she might look for mental health support. And I know that is a tool, that is a mechanism. You watch some TV ads and you got AI chat is planning your day for you.
Yeah.
What are the risks associated with using AI for mental health supports? And I say that because I'm engaged people to people. I think that's going to be the best way to address the needs that we've got. But, and that may be a personal opinion, but tell me the risks associated with AI.
Yeah, I have a personal opinion and a professional opinion. I'll start with the professional. Research is showing that it's not the way to go right now. AI, as you all know, learns on itself, right? So it's learning. So do we really want to put our kids and our adults struggling with mental health and substance use in front of something that's learning and isn't really where it needs to be? So we know that's not a good way to go. We've heard some horror stories of AI and people committing suicide because they asked the wrong question and it said, just go ahead and kill yourself. I mean, that's horrible. We're also aware that you all are looking at passing some legislation that would help put some guardrails on that, as well as federally, they're looking at that, and we need that really, really badly. Personally, I'm a huge believer in the face-to-face, also telehealth component of working with people. AI can't see your facial expressions. AI can't sense your nervousness, anxiety, or anything else, how you look, which all goes into making a clinical assessment of someone. So I'm a big believer in person or telehealth, whichever, where you're seeing a human being who's trained and isn't learning from what they hear.
And thank you, Commissioner. We all need that confidant, whether it be someone in whatever capacity. So I appreciate your work. Thank you very much. Thank you, Chairman.
Thank you.
All right, thank you. Next on the list, let's go to Chairman Hicks. Chairman Hicks of Washington, you're recognized.
Thank you, Mr. Chairman, and Mr. Williams, thank you for being here. Thank you for your hard work, and I want to thank the governor. You know, coming from, I was elected this office in 2021, and you know, 2022 and 2023 was some rough times in addiction recovery, and you could tell it by the numbers, and to look at the numbers now, especially for the overdose rate going down, it's really something. So I appreciate your hard work on that. And it's one of the greatest honors that I get to do down here, to work with you guys and work with Lisa Tipton and Families Free across the great state of Tennessee, and just trying to get people to where they in a better situation for life. So it's an honor to work with you all. In the proposed budget, there's over 2.1 million in non-recurring funding from the opioid abatement fund for the third year of a 4-year program that expands the addiction recovery program. The program includes services such as traditional housing, child care, relapse prevention skills, transportation, and parent education. Can you provide like an update on this program and have the previously appropriated funds all been expended for that program?
Thank you so much for asking. Our Assistant Commissioner of Substance Abuse Services, Taryn Sloss, is in the audience, and I can tell you she and her team have worked tirelessly with Mary Linden, who's also in the audience, Executive Director of TADIS. We have allocated those funds each year, and it's spent on that allocation. We need those funds because these addiction recovery program dollars are wraparound. So our primary funding, the continuum funding, is treatment like IOP or doing medication management or doing therapy, those kinds of things. The wraparound, this ARP allows us to provide housing supports, employment supports, transportation supports, ongoing peer support. So we very much appreciate those dollars. We have expanded the ARP provider dollars with this funding and really appreciate them.
Do you have a number of how many folks that the addiction recovery program served prior to the expansion, and then how many it serves now?
We do have that number, but I'm sorry, I do not have that with me today. I can get that to you. I can show you the exponential increase in provider count as well as number served count, and we'll get that to you.
Okay, thank you. And Mr. Chairman, I got one more question. Were there items that you requested in the 27 budget for the governor that was not included in the budget? Are there items that you requested that wasn't in the governor's budget?
Yes, sir, there were some items, but we are really, really grateful for what was included in the budget. Very grateful for the items included.
Thank you.
Thank you.
Thank you, Mr. Chairman.
I'm going to have to kind of hit right there because I've got a question regarding that. What about the school-based liaisons? What did you request from the administration on that one?
On the school-based liaison, we did get the funding that we requested.
Okay. Next on the list, Chairman Faison.
Thank you, Mr. Chair. Good afternoon.
Good afternoon.
Couple questions. If somebody in Tennessee today raises their hand, says, I'm an addict, I won't help, and they reach out to y'all, but they don't have any insurance,
Yes, sir.
can they get help today?
Yes, sir, they can.
Inpatient help today?
They can get, number one, what y'all funded. We've got the peer support people, we've got the lifeliners, we've got the navigators. Today, if you called me and said, I need someone to get help, I'd immediately connect them with one of the lifeliners in their community.
On their side of Tennessee
Sir?
and their area of Tennessee?
Yes, sir. Yeah, because they know that community. Secondly, you've got what Assistant Commissioner is funding with our provider network. And if they needed inpatient, we would find a bed today.
Even if they don't have insurance?
Even if they don't have insurance. That's the money. You know, when I didn't go over the prevalence slide, you'll note that I show what's privately funded and what's TennCare funded and all of that. Y'all's money to us helps the uninsured. And there's a whole lot of people uninsured that we still have a gap for. But if you're talking about one person, yes, sir, we could get it today.
If they don't have insurance, does the block grant cover that?
Block grant covers some of that, but we don't have enough dollars through the block grant. So all the funding you've given us over the last 7 years goes to help supplement that funding.
Any idea, and you might not know the number, how often does that happen during a day? How many people would call in a day? Is there some days we go, nobody calls, some day goes, there's 10 people called? Do we have an idea of average?
We have an idea from both what Mary Linden keeps with the red line, and I'm sorry, I don't have those numbers and I can't tell you off the top of my head. I will get that to you.
But no matter how many people call today, they can get some help today.
Yes, sir, they can get some help today.
Great. All right, next question, Mr. Chair.
You recognize?
What is the average wait time to get into a state psychiatric hospital?
If you are with a first cert, right? So a first cert's been done and then you come. Right now, the only wait time, because we have beds available in other parts of our system, So if you called and Middle Tennessee's full, which it is today, right? We would see if you would go to another hospital like Memphis that has an open bed. Sometimes people say, I don't want to go to Memphis. I want to stay here and wait. So that person's not really waiting because we had a bed available, right? So I can't give you average wait because we can get them in a bed right now today. But it depends on how long the medical workup is. Sometimes we get calls, and when we dig down, if somebody's saying, well, we've got people that are waiting in the ED for two hours, or they're waiting for a day, we get into it. It's like, well, they're waiting because you're getting them cleared medically. There are tests that you're running so that person can be cleared to come into the hospital.
So part of the governor's plan that Leader Lamberth, when he stepped out, will be carrying is for psychiatric nurses and giving them a little bit more autonomy to be able to handle triage situations with people who are
Yes,
struggling.
sir.
Commissioner, do we have a shortage of psychiatric nurses and workers and psychiatrists in Tennessee?
Yeah, almost all of our counties are designated as workforce shortage areas, almost all of our counties. We
That's
have a
rough.
tremendous shortage. Deputy Commissioner Yancey led the workforce work group where we looked at that by discipline. So we know what it was for psychiatric nurse practitioners, for psychiatrists, for counselors. If you would like us to send that to you, we can be more than happy to send that to you, unless Deputy Commissioner, do you have it with you?
Yes, ma'am.
Great.
So, Chairman, when we looked at this in partnership with TennCare a couple of years ago, we looked at 2030 HRSA data from the federal government. And these are estimated shortages by the year 2030, 4 years from now. But mental health counselors, it's around 1,200 here in Tennessee. Psychologists, 890. Substance use counselors, 830. Psychiatrists, 780. And marriage and family therapists, 140. So the biggest bucket here, of course, are the mental health counselors. And that's one of the reasons we've been so thankful for y'all's investments in the behavioral health scholarship, the Pathways program, because so many of those people are going to school to go to graduate programs to become mental health counselors. So we're really tackling that, but there's more left to tackle across the behavioral health workforce when you think about psychiatric nurse practitioners, psychiatrists, psychologists, and the like.
It would sound to me, Commissioner, and you answer this, that we probably should partner, y'all's department should push our state universities, reminding them the need and for.
Oh, they're doing.
Okay, y'all are working on that?
Yes, sir. Yes, sir. I just
Okay.
was in Chattanooga, at University of Tennessee, Chattanooga, working with their whole medical team and their student body about psychiatry, psychiatric nurse practitioner. We've done a whole review of other states and what they're allowing, because right now, I mean, if you go and you can't see someone in the private market, if any of you have tried to see a psychiatrist or a loved one has in the private market, you're going to wait 6 months to a year. I mean,
That was kind of the reason I asked this question, yeah.
and so whatever we can do to help, that's what we need to be doing.
Okay, one final question. The grants that have been issued through your department, the community agencies that are distributing the funding, how much has been spent by these agencies?
In which amount?
The grants that have been issued to Department of Mental Health Substance Abuse community agencies that are distributing funding, how much has been spent by these agencies?
If you look at the green sheets that you guys have, there's a breakdown.
Okay,
So if you'll go to the pie chart that you got, I really like this. It shows what the amount is for community substance abuse, for community mental health, and for our mental health institutes. What you'll see is right at 611,000. Our admin costs are only 6% for our department. 94% of the dollars go out to the community. So I can tell you that we allocate the dollars. Obviously, sometimes people can't spend all of the dollars because they have vacancies or they start the program a little bit later, but that's what's been attributed.
thank you. Thank you, Mr. Chair.
All right, thank you. Let's go to Representative Gant for a personal order.
Thank you, Mr. Chairman. I want to take an opportunity to recognize former Shelby County Commissioner Mark Billingsley that's with us today, and please make him feel welcome.
All right, thank you and welcome. All right, next on the list, let's go to Leader Cochran. Leader Cochran, you're recognized.
Thank you, Mr. Chairman and Director. Had a few questions. We spoke with General Services about this topic a couple days ago. Wanted to follow back up with you, and that was on Moccasin Bend. You mentioned it earlier in your testimony. Can you provide us just an update, just where we are? I mean, I know that we've been looking at several different locations, and so just kind of bring us up to speed on that.
I'd be more than happy to. We have looked at over 100 properties with Department of General Services. They have been amazing. We have done our very best and had issues with either a community saying, I don't want this in my backyard, and so having to shift from there. But where we are is we've got 2 properties that we think are really very promising. They're doing the due diligence as we speak to see if one of those properties, if we will for sure be able to buy it. We don't think there will be any community fallout from that property. And there's a second property that's a little bit more troublesome that we take a little bit more time for sheriffs to get to, but it's like our Plan B property. Chief, anything you want to add to that?
No, ma'am, I think you covered it very well. We've certainly been trying. We've made a lot of trips. Both of us have made a lot of trips to Chattanooga and surrounding areas, but it's top priority.
It is.
So give me, if you don't mind, give me maybe what would be the goal of completion? A completion date?
The goal is to get shovel in dirt ASAP. Once we do that, they're saying completion date could be anywhere from 1.5 years to 2 years to have it fully built, fully ready to go.
And then compared to the current facility, how many more beds will this facility be?
Again, that's going to depend upon the location and how much we can build out. We've got funding to go up to 200, but each year that's gone by, the amount is changing. So right now, we think we could build up to 200.
Okay, and so, I mean, again, in previous testimony, we heard where, I guess maybe the decision was made based on some archaeological finds at
Yes,
the
sir.
current 80-acre site. While I understand that, and I know this is not your call, I'm getting to my next question. I understand that the archaeological remains, but just about everywhere in Tennessee has some type of archaeological remains. And it's an 80-acre site. There's nothing there that is federal. There's nothing that from the federal government that prohibits us from building on our current site, is my understanding. If it weren't for the archaeological find, would our current site been your preferred site?
When we started this, not knowing about the archaeological find, that was our preferred site. Now, in working with the governor's office, we are absolutely dedicated to finding a site that will meet the needs for the people that we serve every day.
But ultimately, had we built on the 80 acres we currently own, we could have started construction at least a year ago.
I really am not the right person to ask that. That would be Department of General Services. I don't do the construction piece. I can't answer that.
Okay. And then you gave me a number of beds. Tell me, compared to our current number of beds,
Yes, sir.
where would we? How many would we hope to expand in this new facility?
We would hope to expand up to 50 or 25 beds, right? And as you know, we were looking at the expansion in East Tennessee, which would be an additional 25 beds in Knoxville. So that would have gotten to a total of 50 to 75. I don't want to tell you an exact number until we know where we're building and what the cost for beds are, but that's where we started.
Okay, thank you.
Thank you for asking. It means a lot.
No, I appreciate that. And I know that was not your call. I know that's more the administration and general services. But gosh, we have 80 acres right now. I would love to not have to go purchase new property. I would love to have gotten going on the property we own currently. But thank you for giving us an update on where we stand on the project.
And I do need to add, again, I'm not the person to speak to the construction, all that, but I will tell you in the calls, we would have been stuck in litigation for years if we built there because of the type remains that were found. And that would be something, again, that Department of General Services could tell you, how long would we be tied up in lawsuits about even trying to build there. So I think that's an important part.
Okay. All right. Thank you.
Thank you.
All right, thank you. Next on the list, Representative Shaw.
Thank you, Mr. Chairman. Thank you all for
Yes,
being
sir.
here. Of course, you know one of the questions already,
Yes, sir.
Commissioner. But before we get to that, you mentioned faith-based
Yes, sir.
community. And being a pastor, I am aware, because mental illness is critical. It's critical anywhere. But sometimes I think we forget how critical it is in the faith-based community.
Yes, sir.
And of course, we know when it is, you compare the two together, it can be even worse. So how do we, as faith-based community, how do we contact you? Or how
Yes,
do we
sir.
get someone to speak to that issue for us in that
Yes,
area?
sir. We're ready. Stand ready. Director Youngbloom that I spoke about earlier is in the audience. And then Jamie Harper, who works with her with our faith-based communities. We have a certified recovery congregation program. It's as easy as picking up the phone and calling our office. You can call me, text me, and I'll connect you with them. They will talk to whoever the pastor is, whoever the leadership is, and they'll come out and start doing training and do what needs to be done to bring that congregation up onto what they can do and how they can help people that are struggling with mental health and addiction.
One other question before I get to my file burning question.
Yes, sir.
Any plans for the administration building over at Weston?
At this moment, no. As you know, there have been a lot of people that have contacted us, and when they find out what it's going to cost to renovate that building, they walk away. So unless you know somebody that says, yeah.
I thought I knew someone, but
I know
did
you
not.
did. I know. But that's really been the issue, the amount of money that it costs to
Okay.
renovate it.
File burning question. Where's the kitchen?
Where's the kitchen? All righty. Chief, do you want to answer that question?
I guess be glad to. So we are still in the phase where we are, the planning phase of it, working diligently with the architects, with engineering and stream. Right now, we are planning to break ground August or September of this year. And from that point forward, we're looking at 18 to 24 months from the time we break ground to the time of completion. So we're looking at August, September 2028.
Well, thank you, and thank you all for what you do, and thank you for what you do over at Weston. We
Yes,
appreciate
sir.
it.
Yes, sir.
Thank
Thank you.
Thank you, Commissioner. Just a follow-up to Chairman Hicks's question earlier about the community, the school-based behavioral health.
Yes, sir.
We looked back at your original budget presentation to the governor
Yes, sir.
and his staff. It looks as if, though, you and I recognize the desire of the treasurer's office to protect the corpus of the fund, and,
Yes, sir.
and so. But your original request in that presentation was for $7 million for 100 liaisons. This current budget document has $3 million for 43 liaisons. Could you tell what,
Yes,
obviously
sir.
this is really important as the legislature, which is why we set aside so much money for it. So I guess, and it looks as if the interest earnings could allow for us to grow the number of liaisons. Was it the treasurer's direction, or was it your ability, you thought, to hire the additional 57 folks?
Well, let me say something. I'm looking at my list, and I apologize of what we asked for that wasn't included. And I'm not seeing this in the list that I've got here. But what I can tell you is for each liaison, it's about $70,000 to cite one liaison. So whatever amount of money we get, just divide it by 70,000 and that's what we would be able to do.
Mhm.
And again, I apologize. I'm going off of my one sheeter and I don't have that in front of
Well,
me.
and I know it's your job to be grateful for what
We are-
dollars you do get. So I recognize that altogether. But my thinking is the quicker we could, we had to wait several years to be able to start this program because
Yes,
we
sir.
wanted to draw and generate some revenue so that we wouldn't get into the corpus. But now that we're several years past that time, it's as quickly as we can add those, I think
Yes,
we
sir.
would really like to. So it may be that the treasurer felt more comfortable with the 43 at 4
Mhm.
or at 3, but we'll
Mhm.
reach out to him and talk to him about that. But if
Okay.
you were to get the 7 versus the 3 based upon your
Mhm.
original presentation, are you comfortable saying that you could hire the additional 50 some odd
Ab-
liaison?
Absolutely, because you guys have invested in the scholarship program. So we're bringing in master's level prepared people every day. Up to
Mhm.
400 will be here. Yes,
Well,
sir.
and I think it's important to know that those additional positions would reach another 3,000 students in
Absolutely.
our classroom. So I think it's really important for us to do that. So
Absolutely.
thank you very much.
Thank
Next,
you.
next on my list, Representative Freeman.
Thank you, Chairman. I'm not sure. Brian. So I asked this of TennCare earlier, and I think it may be applicable to you as well. At the end of 25, the Trump administration let the enhanced subsidies to the Affordable Care Act expire, leaving 20 plus million Americans, hundreds of thousands of Tennesseans with healthcare costs where the premiums doubled and people had to make tough decisions and just allow the healthcare to lapse. I would assume many in that age range would be need your help. Are you guys planning to see a large group of uninsured folks coming on? And if so, what are you going to do to help that group of people?
Thankfully, you guys have set aside money called the Behavioral Health Safety Net, right? And that allows us to provide the same services that TennCare provides, except for residential. So we are serving any uninsured Tennessean to date that's shown up, and it's our provider community in the audience that does that assessment and provides those services. So far, we haven't had to turn anyone away. So we've had the dollars needed. But we do know there's got to be an expansion if you've got people that don't have insurance and that number grows. We're tracking that. At this moment, we're not seeing a huge percentage, but I don't think we will until the next year and a half, when people start realizing that they need care and can't get it. We'll have a better understanding, I believe, next year. Right now, though, we're able to absorb with the dollars that you guys have given us to serve those Tennesseans.
Yeah, well, thank you for that answer. And I just encourage you to keep us up to speed. I mean,
Yeah.
obviously, this is something that is important to every member on this committee and to the majority of Tennesseans. And if more money is needed, let us know. I'm assuming there's going to have to be more money. So just keep an eye on it. And let
Yes,
us know
sir,
what
we
do.
are.
Thank
We
you.
are. Thank you.
Thank you. Next on my list, Chairman Hale.
Thank you, Chairman. I just wanted to give a couple of shout outs. First of all, thank you so much for all the work that y'all do and partner with one that's really with me is with volunteer behavioral, which serves a lot of our community. But then also had two health department tours recently,
Yeah.
and to see the cooperation that's going on there and having those folks right there in our rural communities is huge. And so I wanted to say thank you for that. When it comes to mental health and substance abuse, as I shared with your liaison yesterday, kind of hits home with me. I had a grandfather that was very big alcoholic, and in '83 shot my grandmother, shot himself. And so to see this, and then the number of families that I sat with, and thankfully, as I shared yesterday, to see our suicide rate drop. And I saw a spike when we were in COVID with what I do every day, and to see that downward trend is a blessing, and I'm thankful for the work that y'all are doing. And you hit it on the head at the ending of your remarks, that when we look at what this does for that individual, what it does for that family, and what it does for our communities, the return on the investment is unbelievable. So thank you for what you're doing, and God bless you.
Absolutely. Thank you so much. I'm sorry about your loss.
Thank you, Chairman. Next on my list, Representative Parkinson.
Thank you, Mr. Chairman. And Mr. Chairman, actually, your line of questioning kind of answered a lot of mine in regards to where I was going. I was one of the things I did want to know, based on the school-based behavioral professionals that we're looking at putting into the schools,
Yes, sir.
is I'm a visual person. So what does that look like? Does that look like an individual that's assigned to a school and they're there 5 days a week, or is that intermittently? How does that look to you?
Yes, sir. It depends on the size of the school. So what we try to do is have one in each school. But if you're in a small community like Crockett County, where I grew up in, you may not need somebody there every day. So you might have one every 3 days, and they go to a neighboring school in Bells. We have the breakdown of that. Again, I can't say enough about Assistant Commissioner Beth and her team. I mean, we can tell you the breakdown if that's what you would like us to follow up on.
But yeah, if you can just get that information to the chairman, that'd be great. And again, and you may have answered this, and I apologize if you did, but what level of mental health professional are we looking at?
Our
for
goal,
assigning school?
yes, sir. Our goal is masters and license prepared. When we first started, we had some that were bachelor's prepared, but are also now getting their masters. But that's the goal.
Okay, thank you for that. Thank you,
Thank
Mr.
you.
Chair.
Thank you, Commissioner. I don't have anyone on the list, but I do want to end with this. You have a little over $5.1 million an allocation this year of non-recurring revenue for sports gambling.
Yes, sir.
This is a one of the fastest growing things really that we've done over the last several years. I have done a little bit of research and reading on this about what's going on in Memphis and at ETSU as it relates to
Yes, sir.
your cooperation there. I did speak to FNA about what we might be doing in this space in Middle Tennessee. I guess the question is that as this sports gambling revenue has grown, obviously those folks that become addicted to this is growing as well. As I've said in this committee before, those folks that were being helped at ETSU, they were gambling around $10,400 a year.
Yeah.
After treatment or after getting help from you and your partners, that's down to like $240. This is really a huge problem, particularly around young males in the state. And so I wanted to tell if you could give me an update on where we are there.
Yes, sir.
Whether that funding's enough, what we're doing as it relates to try to help those kind of in that middle, that donut hole really of what's going on in the state. If you could
Yes,
do that,
sir.
that would be great.
Absolutely. I worked really closely with Deputy Commissioner Yancey and also our Director Youngbloom in the audience. What you'll note is to date, we have expended and are allocating almost $5.3 million. That's what we have gotten, each year allocated by the governor. In addition to that, with our balance from the reserve that wasn't spent, we have projects for non-recurring because they won't continue. You can't do recurring out of that balance. We've got non-recurring projects and funding up to $5.3 million that will be going live next year, leaving us right at $1.3 million as a balance to figure out in non-recurring what we might do to offset. I will ask Deputy Commissioner Yancey, who knows this very closely, what we're doing with those dollars, and then anything else you want to ask, we'll answer.
Yes, ma'am. Chairman, I really appreciate you raising this issue. The good news about young people is that we're seeing less alcohol use, less opioid use, but what we're seeing more of, and you hit it on the nail, hit the nail on the head, is more issues with problem gambling, teenagers, young adults. So we do have a really great partnership with the University of Memphis and their Tiger Clinic, which, as you said, they've expanded out to partner with East Tennessee State University. They have a partnership here in Nashville with Samaritan Recovery. I believe TSU is also involved with that. One of the things that we've talked about conceptually is looking at other population centers across the state, Chattanooga, Jackson, to create more centers. Regardless of a community having a center or not, you can still access treatment via telehealth. But the other thing that we're focused on moving forward are really teenagers and young adults. We're going to be partnering with Chasco to create programming for colleges to educate college students about issues with problem gambling, gambling disorder. I think the other thing we're looking at is the anti-drug prevention coalitions that are across the state in each of your districts. How can we leverage them to educate parents and others about problem gambling? It's become a significant issue. I think online sports gambling has contributed to that, but it's something that we are very fortunate to have these funds for. Very thankful to have the partnerships that we have, but look forward to doing even more because the need requires it.
I guess the only thing really that sticks out to me, what you said, is teenagers that are teen. How does a teenager access a sports gambling website?
I think illegally is how they're doing it. We've worked lock and step with the Sports Wagering Council and the council members as we've built this program. They would be the best to probably speak to those kind of regulatory issues, but we know they are accessing it. I'm not the expert on illegal sports books and things like that, but our partners at Memphis say that's a driving force with a lot of the young people. But they would be best to speak to that. But we know it's an issue. I was actually reading over lunch, I think between 4 to 8% of young people have a gambling disorder. That's fairly significant. And I think the experts expect that to continue to go up.
No, I couldn't agree more, but thank you for your work in this space. I look forward to working with you to try to deal with that a little bit more. Representative Chisholm, you're recognized.
Thank you, Mr. Chairman. First, let me say thank you for all the work you all do. Commissioner, you've been doing this work for a long time. And ladies and gentlemen, I got a chance to work in a program that was under their care, and then we got a chance to help a lot of people. But I do have a question about employee rates. When I was in the field, we were losing a lot of good employees because of the rates. Is there anything you all are already doing? Is there anything this body can do to help in that manner?
I really appreciate you asking that. You guys passed landmark financing about 2 summers ago, $50 million that was put into our provider community and increased salaries. I know if they were all here, they'd be doing a standing ovation because it has drastically reduced turnover. And that's what we've been tracking, is it reduced your turnover, right? Because if you're good with what you're doing, plus you're getting a living wage, you're pretty much going to stay where you're at. So that is something that you've done. The other thing that you've done are our scholarship programs, again, that went to the provider community, partnered with our university systems across the state, and employees that then get that opportunity to get a higher level degree, and they have to turn around and work for that provider for the same amount of time that they got that funding. That's just a win-win. So those are the 2 things that you've already done that are helping.
Thank you so much. And Mr. Chairman, if I may, can I have a personal order at this time?
Absolutely.
I want to, we got some people from Memphis in here.
Yes, you do.
We got my good friend, Miss Danielle Anez, and her son, Joey is here. Joey, will you please stand so we can see you? Make them feel welcome. Thank you so much.
You are so welcome. Commissioner, thank you
Yes, sir.
for you and your team. I don't have anyone else on the list, so appreciate you and your team's hard work and look forward to seeing y'all later in session. So thank you.
Thank you so much.
Yep. And next up is the Department of Aging and Disability, or Disability and Aging. Commissioner Turner and his team, if you guys will, I see him there in the back. If you and your team will make your way up, we'll get started as soon as you get settled. One more after this. All right, folks, you can congratulate each other in the hall about how great you did. You don't have to go, but you can't stay here, as Chairman Vaughn says. No, not you. Folks, we're going to go ahead and get started. The wheels are coming off on the front row, and so Commissioner Turner, I'm not sure you got our best, but you have our attention. So if you would introduce your team, and you may begin when you're ready.
I will. Thank you, Chairman. So it's a pleasure to be here. Again, for those who don't know me, I'm Commissioner Brad Turner for the Tennessee Department of Discipline and Aging. To my left is Deputy Commissioner Jordan Allen with Program Operations. To my right is David Com, our Budget Director. And with that, Mr. Chairman, I'm going to turn it over to David to go through our budget presentation.
All right, thank you.
Thank you, Commissioner. Good afternoon, committee. Thank you for your time today. We'll make this presentation pretty short for you so we can get to your questions. To kick off the presentation, our first slide up on there is our base reductions for the year for fiscal year 27. We've met our agency reduction target this year by our utilization and attrition, which is based on our 1915C waiver from individuals who've either passed or disenrolled. We also did eliminate one long-term vacancy position as part of the reduction. The next couple slides we have, won't go through them in full detail, but we wanted to call out and highlight some of our programmatic wins and successes, as well as some of the grants that we've been able to award to individuals in the community of Tennessee, thanks to the great support that we've had from the administration and the legislature over the past few years, which we're very appreciative of. And then last, but certainly not least, we wanted to highlight our capital improvements, which I know are of great interest to a lot of people on here, and we're very excited about. We can now report that as of January, we've hit over 70% completion in all 3 regional office buildings and facilities, with East just hitting that 70% mark, Middle tracking really close to 80% now, and then our West facility at 100% completion as of the end of October. And we have our ribbon cutting ceremony and open house this Friday, which we're excited about. We have, at this point, about $128 million of expenses on that project of the original budget, but all are tracking to be fully finished on time, all invoices paid by the end of the calendar year to meet our deadline for those funding. With that, I'll turn it back over to Commissioner Turner for any questions. Appreciate your time.
Yeah, thank you, David. And Mr. Chairman, I'll give it back to you, and we're certainly happy to answer any questions or follow-up of any concerns or issues.
Thank you, Commissioner. I do have a few people on the list. If you'd like to be on the list, let me know. First on the list is Chairman Faison. Chairman Faison, you're recognized.
Thank you, Mr. Chair. The 26 budget included $3.6 million to reduce the wait list in the senior nutrition program. According to the department's response to the HFWM questionnaire, the current wait list for the program is 7,436 persons. The department requests an additional $9.4 million for the senior nutrition program wait list and meal rate increase. This request was not funded. Commissioner, would you talk about the impact of not receiving the funding? And is that wait list, is it growing every day, and what's going on with us not funding that?
Yes, sir. Thank you, Representative Faison, for the question. Yes, there's always going to be an impact. I think most on this committee know in Tennessee, the fastest growing demographic is actually over 60. It's the aging community, and specifically in your area, and we talked about this in the Appalachia area, that's the fastest growing area in the entire state. So there is an impact there. But we've tried to be really creative. The governor's encouraged us to work with other departments to make sure that we're maximizing the dollars that you have allocated as a state body of legislators. We worked very closely when Commissioner Hatcher was here with the Department of Agriculture, and now with Commissioner Holt, to utilize Tennessee farmers to work with us to deliver fresh fruits and vegetables to senior centers and making sure that those sorts of meals and food are available. But truthfully, there is going to be a need, and there is going to be a growing need, because Tennessee is in a position where people want to move here, which is something I think we're all proud of. But that's also something that we're planning on, and we're trying to make sure that we address, whether we have funds or not. We still have to address those challenges.
Chairman, can I follow up?
Yes.
Thank you. Commissioner, when you were sharing that, it made me think TWA was here yesterday, and we have the way they would put it is an overpopulation of deer.
Yes, sir.
Just wondering, have you ever reached out to Hunters for the Hungry? My family, we've harvested several deer, donated to the Hunters for the Hungry, and I know, speaking with them, that there are times that they have more meat than they have people who can use it. So
Yes, sir.
I just wanted to bring that up to you. I think after he said that, and they're probably going to be a little bit more liberal with the amount of take for the next, the fall of 26.
Yes, sir.
I would say there's going to be an abundance of that. And I just wanted to bring that up to you, that it might be something you look into, Hunters for the Hungry.
Yes, sir, we did. And we actually I had
Okay.
a meeting with the executive director of TWRA, and that was a very pointed conversation related to what can we do together for folks to not only get into the outdoors that might have disabilities, but also the ability to understand the importance of the kill, the importance of the meat, the importance of serving people in the community that may need that meat. So that's a long-winded answer, Representative Fay, to say, yes, sir, we have had that. I'm hoping that we can continue those discussions moving forward. Now, the only caveat to that is if they're as challenging of a shot as he is when he hunts, we're going to be in big trouble. But we're going to rely on other Tennessee hunters to come through for us.
Mr. Chair and Commissioner, I've been told from Representative Darby that our fearless leader over here, Rooster Man, is an excellent shot at like 250 yards. So maybe
Excellent.
you two could get together
That's
and learn
perfect.
how to shoot from him.
That's
He actually shot
happy to
a
do
clay
so.
pigeon with a pistol, and there's pictures of him doing that. So I'm surely he can teach you.
Absolutely. Thank you.
Leader Lambert, your rooster name was called.
Y'all stop, okay?
Yes, sir.
But, I mean, I love all y'all, but I do fully support Hunters for the Hungry and all our sporting traditions. And yes, we did harvest 7 deer this year that are in the freezer, feeding my family. And it's the best organic beef you can ever find. Even though it ain't beef, you'll like it better.
Thank you. Next on my list, Chairman Hale, you're recognized.
Thank you, Chairman. Commissioner, thank you and your team.
Yes, sir.
So want to go to the adult changing tables. FY 22-23 budget appropriated $1 million in non-recurring funding to establish a grant program for adult changing tables. According to your response in the questionnaire, $700,000 of this funding remains unobligated as of June 30, 25. So the department has mentioned that they're working with TDOT to install adult changing tables at rest areas across the state. So my first question, the capital budget includes $165 million to renovate and replace rest areas and welcome centers statewide. So will any of the unobligated funding from this grant be used to install adult changing tables in this renovation replacement?
It's not directly from that grant funding, but we are working very closely with TDOT on those rest stops. So your timing is perfect. I think most of you know or have met with folks today. It's Disability Day on the Hill. This conversation just came up about 2 hours ago with the lady and her family that was actually on the Tennessee Council of Developmental Disabilities that helped spearhead that. So we are working closely with TDOT. I will be fully transparent with the committee that there's been obviously turnover over there with different leadership. When Commissioner Ely was there and Steve Townsend and others, they were there involved in the beginning. We're in the process of making sure that we continue to educate TDOT on the importance and the value of that. But my anticipation and my understanding is those conversations are going to continue, and adult changing tables are going to be part of that through the budgeted process on the TDOT side. So I'm very happy with where we are on that. But if I can expand on your question a little bit, if it's okay, we are actively working to recruit businesses, share with schools, share with public municipalities, different entities, churches, houses of worship, that they are eligible to apply for the grant, and the dollars are still there. So I would ask the committee to help us. If you know people in your area that you think might benefit from approaching us and requesting a grant and submitting an application, please do so, because those dollars are out there allocated and they're also unassigned right now, except for that project.
Okay, and one more question to that, and then I have another area I wanted to ask about. So have you denied grant funds to any private or nonprofit entities in order to set money aside for installation at rest areas or welcome centers? Have you denied any?
No,
Okay.
no, sir, not to my knowledge. Anyone that's come to us that meets the very basic qualifications and criteria, we work to give them the dollars to install the changing tables.
Okay, all right. So I wanted to hit, because of TennCare and stuff, on the Katie Beckett Part B.
Yes, sir.
So you mentioned that in the slide that there's 4,700 families currently being served by that.
Yes, sir.
So how many is that meeting all of the requests? Are there more needs with that $10,000? So is there, 6,000 or 4,700 all we're able to do, or where are we at?
Yes, sir. It's a little bit of both. So those slots are 4,700 families that are receiving services and supports through Part B. But we're on average right now of anywhere between 225 and 250 a month, reaching out to us asking about the Katie Beckett waiver that are not there. We have no slots available. The only time we lose slots is when a child moves from that program because they age out, or unfortunately a child passes away and is no longer participating in the program. But there is a need, and that need is growing.
So, and this being children, and that kind of concerns me there. So how much greater is that need? I mean, if we're not funding to meet the need for those children, how much is that need?
I think by the end of this year, and I want Jordan to hold me accountable here, we'll be close to probably 3,500 to 4,000 families that might be waiting on a slot to open.
Okay. Okay. All right. And I hope that as we're looking at things, we make sure that that's a priority, that we're taking care of these children. And so, helping with that. So thank you so
Yes, sir.
much, Chairman. Thank you.
Thank you, Chairman Hale. Just to follow up on the adult changing tables, I did have someone from my district, and I don't know if this is true or not, or the thought, or maybe a barrier, I guess, as it relates to the changing tables. It's a reimbursement. So someone would have to go and install the bed, install the changing table in their facility, and then submit for reimbursement.
Correct.
Have we considered the idea of maybe giving them, if they apply and get awarded, that they'd get half the money? And if not, what's the general turnaround time for someone to get reimbursement once they have it completed and your team inspects it?
It's a good question because we've been asked that. So one of the things that we tried to be really careful with was not give all of the money and then they come back and say, well, we only needed 7,000 of the 10,000 or something like that. But we have looked at that. So our general turnaround time is under 30 days. So we don't want families and businesses that are investing in that to have to sit here and wait on our department to process a check. So David and his team have done a really good job of accelerating that. I'll be honest, before we did have it a little bit longer, but over time we've been able to cut down on how quickly we turn around and reimburse businesses and families and municipalities on an investment that they made to serve a very vulnerable population. So I'm really pleased with the turnaround time, Mr. Chairman, and I don't anticipate that being anything that changes in the future.
Okay, thank you.
Sure.
That's what I discussed with them, was the turnaround time. If it's 30 days or less, it's not an imposition to them, I suppose, to do that upfront investment, knowing that they're going to get
right. And obviously the committee reserves a right to reach out to us. It's easy for me to say, well, that's not a lot of money you're going to miss, when I'm not the one missing the money.
Exactly.
So we certainly want to be respectful. If you get someone that calls you, please reach out to us and we will certainly look to figure out how we can accelerate that reimbursement.
Okay, thank you. Next on my list, I have Chairman Gillespie.
Thank you, Mr. Chair. Commissioner, thank you so much, and team, for being here. Issue that means a lot to me, Alzheimer's and dementia respite care. Since 2023, your agency has received a total of about $3 million non-recurring for the Alzheimer's respite pilot program. This past year, the department requested an additional $2 million for that program. That unfortunately was not funded. I guess my question is, how many individuals were or have been served through the pilot program to date? And then I've got a couple of follow-up questions.
Yeah, that's a good question. It's a little bit under 1,000 that have been served in that. But I will tell you, one of the words that was used a couple weeks ago, Representative Gillespie, when Alzheimer's Tennessee was here and they had Alzheimer's Day on the Hill, was these grants are transformational for families. So there's very clearly a desire for those to continue, and they understanding the impact of that. I have spoken to this before as a parent. I think we underestimate the impact on the caregiver, on their mental health, emotional health, physical health, spiritual health, that I can speak to in person. I'm really tired, and I'm not tired from the kind that I can go take a nap. They're going through it too. So the fact that we've served 1,000 people is very encouraging to me, but I know that there's several thousand out there that are wondering, well, who sees me? Because I'm not one of those that's getting help. So I'm very passionate about this, and I think it's something we need to continue to work on together. And I'm really happy that we're able to serve this group. but I know that that need is exponential and growing.
Thank you. Mr. Chairman, follow up. Thank you so much. And I agree with you. Having my family and I just went through this with my father for 3 years. It takes a toll. And I know there are other families out there that the toll is 1,000 times worse than
Yes,
what we
sir.
went through. So it's effective, which I think we all kind of could have guessed at. That additional $2 million, if you're saying 1,000 people were served with the $3 million, I'm doing some rough math here. How much more need is there? Because I know it's ongoing.
Yeah, that's truthfully the answer, right? It's ongoing, and I don't know if we're ever going to meet the need, but that's not an excuse to not try. So what we believe is we do what we can do, and then we figure out how to try to make up the difference later. And so you would have hundreds, if not thousands of more people that would be engaged in that. And one of those things is messaging. We've worked really hard on making sure that folks know that our department is available to help them. In fact, I just got a text from a friend from church who said, hey, I really need to know more about this because this issue has challenged my family now with my aging parents. It's also us getting the messaging out. So we also know that the more that we get the messaging out and communicate more effectively, more people are going to know about it and the need is going to become greater. So I think sometimes we see, well, why is it just that amount of people? What's that amount of people? Because we have to control the number of people that are knowing about it because we can't help everybody yet. But that's never been acceptable in our department. We've always tried to get super creative on how to do it and what we're going to do. And for me, quite frankly, it's very simple. Christ commanded me to do this. There is no in between in what scripture says about the vulnerable, the weak, the disabled, the infirm, the sick, and the aging. You're either in or out, and we're in. And so I'm really excited about what we're doing, but the need is great, which means that there's the field is ripe for the harvest. So we need to get out and get people.
Thank you, Mr. Chair. And I could not agree with you more. I'd love to talk with you and your office about this more. So please reach out to me.
I will. I'll make
you.
sure our legislative
for
team
those-
reaches out to you and sets up some time.
Thank you so much.
Yes,
And
sir.
for those listening, I just hope everyone heard what the commissioner just said about that program.
Thank you, Chairman Gillespie. And Commissioner, I just want to say that when I carried that bill originally for the pilot program for Alzheimer's, Representative Shaw is very passionate about that as well. I am too. Obviously, our families do that. We found out today, Memaw Jones, she has a bill to extend that pilot program. I think one of the biggest impacts we can have, though, is to get some real data really back from what happened. I think, of course, we had to extend it another year because we had a little bit of difficulty getting the monies deployed.
That's right.
And so we know that in other states, Florida in particularly, have really doubled down on the respite care programs particularly for Alzheimer's. I think it's something that we should do because you're right. The caregiver in this situation, particularly with Alzheimer's, is the most important person in the equation. But I also think you make a pretty good case in point. I had a Katie Beckett family from my district in the office this morning, and the parents, young married couple, 2 kids, youngest has extreme challenges, and they face what you do every day. And so it's my hope that we maybe broaden the horizon and look at what that might mean, particularly for those like your family and their families, to give them the respite care, because they're working 90 hours. Well, the husband's working 90 hours a week. The mom's working 60 hours a week for the state. And it's just more than they can bear to be able to do it. Just to be able to go get your hair done and go to the bank would be huge for these families, particularly as you well know. And so hopefully we can continue the discussion. Representative Jones has that bill to continue the pilot program at the current funding level. And so hopefully we'll be able to do that so you can continue to provide these services to those folks. But I appreciate your hard work around that space.
Thank
But
you.
I think we can do better. So
thank you.
Representative Love is next on my list.
Thank you, Mr. Chairman. Thank you all again for what you're doing.
Yes, sir.
I did want to ask this question about what would you say is the most prevalent threat to our seniors? Is it financial exploitation or physical abuse and exploitation?
I think there's a lot of that, Representative Love, that financial exploitation being one of them. Housing is a massive challenge. The caregiving space, one of the things that we don't want to do that I think, and Chairman Williams just kind of mentioned the direction I was taking this conversation, is a safety net is a safety net. We should not create it as a destination. It's a safety net for a reason. But the more that we don't address some of these issues, the safety net becomes the destination because people don't believe there's anything left for them to go to. And so we don't want to do that. So housing is a massive challenge, financial exploitation. I really want to thank the legislature for the hard work that you've done around the AI space and the impersonations and things like that. I mean, you hear about it in the music space. We're starting to run into that where we're working with TBI and Director Roush around AI and people using telephone calls who sound like a family member to say, I'm in trouble. I need $500, $1,000. That's a massive issue that I'm really worried about because that is a demographic that is not always technology friendly or wants to deal with technology. They want to be on the telephone. And if you call the house, they're going to answer. If you do this, they're going to answer. And so I'm really worried about that. So I don't know if I would just say there's one thing specific. I think it's an aggregate of everything that is impacting the aging space that we've got to do a better job of protecting them. But if you had to pin me down and say I need an answer, financial exploitation, housing, and the ability for them to live in their home and age in their home the same as any of us would want to would be the three that I would say are massive challenges.
Thank you, Mr. Chairman. One more
Yes,
question. Do you providing services for persons with autism?
Yes, sir.
Do we have in-state programs?
We do. Now, we don't necessarily have a direct autism waiver. In fact, that's been a conversation that we've been having. But yes, so the Katie Beckett waiver, family support programs, the ECF program, those are programs that individuals that have an autism diagnosis can participate in.
Okay. If I could talk to you after.
Sure.
Thank you. Thank you, Mr. Chairman.
Absolutely.
All right, thank you. Next on the list, Representative Freeman, you're recognized. All right, thank you. Let's go to Representative Chisholm. You're recognized.
Thank you, Mr. Chairman. What can you speak to some of the resources or incentives that you all have for caregivers? Because I know you all mentioned some of it, but can you expound upon it a little bit?
Yes, sir. I mean, I think the easiest thing without deflecting from your question is our regional offices have an entire list of programs that folks can reach out to get information on. If they're not comfortable doing that, our website lists all the information around caregivers and supports and programs that we have to help them. One of the things that we've started to talk about, Representative Chisholm, and I think it actually just came up with Commissioner Williams, we're not even talking about the mental health of caregivers or the mental health of people that they support. Historically, our population with disabilities has been grossly discriminated against where people are saying where they're doing that because they're disabled. Like that is the most naive statement because that's an assumption based on ability that they're doing that because they can't do something else. So we want to talk about the mental health of caregivers. The short answer to your question is yes, sir. We do have available resources. We do have available lists of programs. I would encourage anyone that's listening or we can work with your office. We can give you that information to better allow them to assess what they might need, and then we can provide services and supports around that for caregivers.
Yeah, thank you for that.
Yes, sir.
Because like some of the other members of this body, I too me and my family, we just finished a round of being caregivers to a family member, and the amount of everything that it took to go through that process. We want to make it easier for families in Tennessee to be able to go through that process.
It's aging is a privilege, but it doesn't always mean it's easy. And we try to encourage folks to say, hey, it's a blessing to have an aging parent, but we know that it can be hard and we're going to be here to help you every step of the way.
Yeah. Well, I heard it was reserved for only the tough people. So
yeah.
Mr. Chairman. Thank you. Next on the list, Representative Sparks. You recognize.
Thank you, Commissioner. Commissioner Dad told me to tell you hello.
Okay, yeah.
He's I just met you on Facebook. One reason you're passionate, I think most people know one reason you're passionate about this, but wondered if you could expound on one reason why you're passionate, your daughter Kinsley, and also the Freedom Playground Park in Smyrna that this body was instrumental in, and you and Representative Robert Stevens and our local Rotary Club. The governor, I think, put in $75,000 in the budget with it. But can you expand on those two things, why they're important, why they matter?
Yeah, I mean, as Representative Sparks alluded to, I'm a parent, and so I live this every day. This is not, something that I just do because it's a job. But I've been very blessed, and as one of my favorite poets, UGK, said, the game has been good to me. And I've been very fortunate, and I appreciate that you recognize some esteemed poets like that. But what's important to me about that is not everybody, Representative Sparks, has the ability to do the things that we have been able to do with those playgrounds and to be able to blend in those communities. What we're trying to do is make sure that every child knows that they're wanted in the community, that every child knows that they are free to play with whoever they want in those playgrounds. And really what we have found out is those playgrounds have become center points for community growth and for families to actually understand what their neighbor's going through. So as we've been doing that, I do want to thank the legislature for our Freedom Playground in Smyrna, but there's been other parts of the state where they have done that has been wildly successful. And so I think sometimes we underestimate the importance of just making a small investment because the dignity of a person matters. The playgrounds have been very reflective of that. And I'm very excited about the growth that we've seen in people playing on those playgrounds, but most importantly, the community engagement with children with disabilities.
Yes, thank you, Commissioner.
You're welcome.
Thank you. Next on the list, Representative Parkinson. You're recognized.
Thank you, Mr. Chair, and thank you for the reference to those poets. They actually graduated from my high school.
Yes, sir.
Yeah, a few years behind.
Yes, sir.
Me. So yeah, they also mentioned, embarrassing things that we want to cut all the embarrassing
That's right.
stuff out.
That's
you
right.
know,
That's right.
Yeah. So I want to first of all, I can't even garner the words to tell you how important you are to us, and how important your passion is. For our aging community and our community with disabilities. A dear friend of mine, Dr. Shaquita Starks, when she was in research at UT Health Science Center, she's now moved on to Emory and to Johns Hopkins and bigger, a lot of other things. Right? She's an amazing trained DNP in mental health. She wrote a paper on caregivers years ago, and how in many cases the caregivers would take on the illness of the person that they were caring for, number one, and in many cases the caregivers would actually leave here before the person that they were caring for.
Yeah.
And it's such a heavy lift, for to be a caregiver, and we have a lot of people that are caregivers for relatives, parents, children in some cases, and I do want to applaud us, your department and us as a state also, and as members for passing meaningful legislation that would allow relatives to be able to, be compensated while they're working in the care of their other relatives. And we did that at the programmatic level and at the medical professional level also. And so, I thank you all for that. And I just want to publicly say, you guys are truly appreciated. And it's absolutely God's work that you guys do for our people in our community, in our state. So thank you so much.
Thank you. Appreciate you saying that. And let me be clear if I can, Mr. Chairman, that's nothing I've done. Like, I've got a team around me that's much smarter than me, and I'm smart enough to be quiet and let them tell me what to do. So it's these guys and the people behind me that are doing the heavy lifting. But very kind of you to say that. Thank you.
All right. Thank you. Next on the list, let's go to Chairman Williams. Chairman Williams, you're recognized.
Thank you. I'd be remiss. Thank you, Chairman. I'd be remiss if I didn't say this. 16 years I've served in this body. And I will say, don't know why I'm getting choked up. I will say, in the hall talk, there is a little bit of hall talk about like who's going to stick around for the next administration. And I know you're very passionate about what it is you do. And in the 16 years that I've been here, you are at the top of the list that we'd love to see stick around. And so I want you to know that the people of Tennessee, this body, are really grateful, really, for the work that you've done. I don't know that anyone, and yeah, you do have a phenomenal staff, but that staff really beats to the rhythm of your drum. And so we're very, very appreciative of the work you've done. It's a very difficult space. It's a very difficult thing, but there was no one as gifted than you to be in the role that you're at. And so I hope, as you think about what's going to happen in the future, we hope to see this not to be your last budget hearing, is what I'm saying. So thank you for your hard work. Yeah.
I really appreciate you saying, look, Chair, I'm a sinner saved by grace. And I've learned a lot more in the valley than I did on the mountaintop about what this means for people that I serve and support. So to your point, it's a privilege for me to sit here because there's a lot of families that are counting on me to get this right. And I've probably made a lot of mistakes, but none that were too much for Jesus to reach down and say, keep going. So I'm going to keep going until he tells me my time is up. But until my time's up, we're going to keep swinging. So thank you for saying that.
Well said, Commissioner. Well said. I have no one else on the list, and I can't think of a better way to finish this. So thank you for your words. Thank you for your presentation.
Thank you.
And members, we will, at this time, we're going to go ahead and transition over to the Department of Children's Services. And Commissioner Margie Quinn.
They provided the names of everyone that will be at the table.
Great.
In case, I know sometimes you want.
Good. Good. As our presenters get settled in, I'm going to go to Representative Miller for a personal order. Representative Miller, you're recognized.
Thank you, Mr. Chairman. Mr. Chairman, I wanted to recognize a commissioner from Shelby County, Commissioner Charlie Caswell. Let's welcome him.
All right. Thank you. Thank you for being here. All right, Commissioner, I think everyone is getting seated and ready to proceed. Just want to remind you that we will control the microphones up here. So as you get ready to speak, just make sure that red light comes on, then you can begin. If you would, just begin with the introductions of who you are and who you have with you. And again, thank you for being here today and for presenting.
Good afternoon, Chairman Hicks and honorable members of the House Finance, Ways and Means Committee. I am Commissioner Margie Quinn, and with me today are Chief of Staff Andy Varinsky, Assistant Commissioner and Director of Finance and Budget Mohammed El Casey, Deputy Commissioner and General Counsel Sammy Mayfair, when she jumps in, Director of Legislative Affairs Jim Lehman, and Executive Director of Network Development Frank Mix. We will highlight the positive progress at DCS, identify our proposed budget improvements and actions underway that answer this question: what is in the best interest of a Tennessee child? Earlier today, Assistant Secretary Alex Adams and Deputy Assistant Secretary Cody Inman of the Department of Health and Human Services joined Governor Lee as he signed a proclamation pledging Tennessee as one of the first states to join in the effort committed to ensuring a home for every child. The proclamation reads in part, the state of Tennessee has made significant and measurable improvements to its child welfare system, including enhanced safety practices, stronger family engagement, expanded prevention services, improved permanency outcomes, and demonstrated commitment to continuous quality improvement. We appreciate the Trump administration giving control back to the states. Our employee retention rate has seen steady improvement, leading to stable and supportive environments for children and families. Adoptions have been celebrated, and improved controls have enhanced overall agency outcomes. At DCS, our focus is on meeting the complex needs of today's children, focusing on keeping families, kinship, or relatives together whenever possible. Our Safe Baby Court program, operational in 22 counties, has effectively and compassionately reduced the number of children reentering state care. A $25 million investment in the first 2 years towards case manager compensation allowed DCS to raise salaries from $43,600 per year to a starting salary of $50,400. Our retention rates have steadily increased and remained level year over year, with close scrutiny and strategies around training and field mentoring. $44 million in investments over 3 years has enabled our network development team to work with providers to increase capacity for the clinical placement of youth needing high acuity mental and behavioral health care. These treatment beds have served over 2,400 youth and steadily reduced the number of children and youth waiting in transitional homes across the state from an average of 120 per night in 2022 to 26 per night in 2026. An additional $10 million to the Clearinghouse-approved Intercept program allowed DCS to target the 15 counties contributing 50% of the foster care children coming into custody. This budget initiative, which began in July 2025, added 301 new slots to those counties. We have already seen a 12% reduction in the cases in just over 7 months. The Relative Caregiver Program, currently at max liability of $32 million, has served 4,264 unique children placed with relatives following juvenile court decisions. The families receive 50% of the foster care board rate. As of this month, there is a wait list of 998 children. There are 3 graphs on this slide, all depicting custodial trends. The first graph shows the 5% reduction in children in custody according to the yearly average from 2022 to 2026. There is an ebb and flow of the number of children who come into and out of custody. The small graph below shows the initial success of the assessment center stays for youth ages 13 to 17. For youth who stay approximately 42 days at the assessment center, they stay twice as long in their next placement as youth who do not go through the assessment center. The graph on the far right depicts the average number of placements per 1,000 days in custody. And we are showing this across multiple years, beginning while the department was under the Brian A. lawsuit. When the oversight ended, and what the department has done while out from underneath federal monitoring. As you can see, there has been a steep decline in the last 3 years. Placement stability is good for children and youth. The $433 million real estate plan, fully funded by this General Assembly, will modernize the state's child welfare agency and bring it boldly into the 21st century. DCS has never had its own buildings, never had intentional places to bring children and youth into care. Beginning this year, Tennessee will begin to build careful, modern, thoughtful places and spaces for children and youth when they must enter the state's care. This map depicts the first 4 groundbreaking sites in 2026: Jonesboro, Tullahoma, Lexington, and Somerville, where we will begin to build a new juvenile justice campus. We look forward to presenting the full purpose-built spaces on April 9th to the State Building Commission. On slide 5, you will see the 6 regions and the color-coded graph with the current state caseload averages by unit and the future state caseload averages by unit should the private provider case management recurring budget increase receive funding. The current budget has 95 private provider case managers carrying approximately 1,600 cases. This budget item is set to expire on June 30th. If it is not funded, these 1,600 cases will revert back to DCS case managers. On the next 2 slides, we'll jump into our 2027 budget. The largest drivers, the residential custodial budget at $36.8 million and the private provider case management at $34.5 million. The residential custodial budget at $36.8 million is the largest single increase in the budget, and it addresses the rising demand for residential placement for children with complex needs. It also addresses inflationary pressures on provider contracts and staffing costs. The impact is that it prevents placement disruptions and continues to allow the department to place youth timely. The private provider case management, $34.5 million combined, is a continuation at $13.4 million and an additional expansion of $21.1 million. It expands private provider case management capacity to reduce caseloads for state employee case managers. The impact is that it reduces placement instability and improves permanency outcomes. It supports workforce stability and retention and reduces turnover. These cost drivers are strategic investments in our department. They directly address capacity, workforce stability, and child safety. Without the increases, Tennessee risks placement shortages, higher caseloads, and workforce instability. On slide 8, we're asking for a supplemental budget increase. The Department of Children's Services is requesting supplemental funding to address urgent needs that cannot wait until the next fiscal cycle. These requests ensure continuity of care and stability for Tennessee's most vulnerable children. Rising demand for residential placements and intensive foster care services due to increased complexity of youth behavioral, medical, developmental, and mental health needs. Without them, Tennessee risks placement shortages for higher needs children, increased instability for children in care, and more youth spending longer times waiting in transitional settings. This investment reflects a proactive approach to uphold Tennessee's commitment to child welfare and systemic improvement. We'd like to leave you with the positive impact on a child and family's life. This mother is here today, and they are one of your constituents. Their experience reflects what your investment makes possible. I'm not going to reveal her name so as not to identify her children, and I want to thank her for being here today. This is her letter. My son was recently discharged from the Intercept program. We struggled with my son for a long time. He has autism, and his behavior had become quite aggressive. We felt like we tried every type of therapy and service, and it wasn't working. He would go into the hospital for a few days at a time, one time out of state. And it's really scary as a parent when they're out there, out of the home, and you can't see them or talk to him. I'm his mom. I wanted to be able to care for him, but I also have 3 other kids I have to keep safe. So we got to a point that we thought an out-of-home treatment would be the only option. But then we were referred to Youth Village's Intercept program. Our specialist came to our home multiple times a week, and the progress was slow, but it was steady. And she was so patient with me because, of course, tension was high, and I would get overwhelmed. But she worked with me as the mom on ways I can shift my communication and reinforce positive behavior. She worked with my other children, particularly my youngest daughter, who had become afraid of my son, and reassured her that we're working hard to get through this as a family, and gave her her own coping strategies. And most importantly, she worked with my son to understand when he's getting upset and healthier ways to manage his emotions. Now my son's meltdowns are basically non-existent. He's really learned how to self-regulate. He does his countdown or he goes to his room and calms down. As a mom, I can't emphasize enough how much it means to know that he is not at risk to himself or others, and that all of the progress could happen under my roof. Our specialist even sat down with me to go through all the paperwork to get him set up with continued services, and we now have a registered behavior technician in the home 6 days a week. Youth Villages even made sure all our kids got Christmas presents. Thank you to the Department of Children's Services for all your investment in keeping families together. I hope every family who's struggling similarly has an access to services like Intercept. These investments are about fewer children entering custody, shorter stays, safer placements, and stronger families. We are seeing measurable progress, and this budget protects that progress. Thank you.
All right, thank you very much. Thank you for your presentation. Several folks on the list here to ask a couple questions regarding your budget. Let's begin with Leader Lamberth. Leader Lamberth, you're recognized.
Chairman, thank you, and Commissioner, thank you for sharing that letter. I'm pretty confident I know the mother that wrote that letter, and I want to thank her for bravely sharing her testimony and for being a good mom who does everything she can to take care of her kids' needs and continues to reach out. I also want to thank Youth Villages for leading them through that journey. So thank you. And I know we have some folks here from Youth Villages today. So I want to publicly say thank you, and specifically to that mother for sharing her testimony here.
Thank you, Leader. Chairman Hawk, you're recognized.
Thank you, Mr. Chairman. Commissioner, your team, thank you very much for being here. I want to talk a little bit about residential custodial care and the budget therein.
Yes, sir.
That budget from DCS has doubled since 2021. I fear we're not drawing down federal dollars that we could or should be. How does that component of your budget flesh out federal dollars to state dollars?
That's an excellent question, and I appreciate your question. As we've seen kids enter into care that required higher and higher levels of care, placement has become more and more difficult. And we receive federal drawdown for certain levels of care. And when a child needs care that exceeds the approved placement, sometimes we have to go over and above what is the approved levels of care. So we enter into what is called a unique care agreement. And what happens is we pay for the approved level of care, and we draw down the federal funds under the approved level of care, which would be, say, a level four, which is the highest level of care. And then the state pays over and above in a unique care agreement. And sometimes that means a provider has to hire extra staff, extra nursing staff, in order to accommodate that youth's particular behavioral or mental health needs. And so that has caused some increases in our budget. And then I would turn to Director Mix if he has additional comments about why our custodial budget, and this is really, we call it a custodial budget, but it really is a child mental health budget.
Sure. Frank Mix, Executive Director of Network Development and Provider Relations. I'm happy to talk about this issue as well. This is the work that I live every day. As Commissioner said, placements become more challenging. We've talked about high acuity many times. The level of federal funding versus state funding varies by level of care. It can, for our highest levels of care, at the established rates, the state will pay about 33% of the cost of care when that care is approved through a level of service with our partners over at TennCare. It can be lower if it's a less treatment intensive piece of care. I do believe there's some opportunities there to maximize the federal dollars. We've been working with some external consultants and our partners at TennCare to modernize our levels of care and establish the correct funding levels for those.
Chairman Hawk, you recognized.
Thank you, Mr. Chairman. Tell me about the kinship placements. We've done some work, this finance committee, the administration has done some work around kinship placements. Other states are head and shoulders above where Tennessee is in terms of kinship placements. Where are the reimbursements, federal versus state, in that regard? I'm seeing that our kinship placements are quite low compared to our sister states.
Yeah, there's been some significant improvement in our kinship work. A piece of that work doesn't fall within my scope of work I work on every day. Can certainly get a federal breakdown of dollars there, but we've made some good progress in that area. Roughly 20% of our kiddos are in kinship-based care. We follow the federal guidelines to reduce the training requirements for those families so we can offer them the full foster home reimbursement rate. And now we are exploring ways to support those families when those kids have higher needs through our private provider communities who have expertise. Those families not only have challenging behaviors in the young people they're serving, they potentially have a challenging familial relationship they also have to manage at the same time.
Chairman Hall.
Thank you, Mr. Chairman. And two more. And just, you mentioned the private providers. Tell me about what we're doing with intake assessments on these kiddos. What are we doing are we doing it both with our DCS employees and then a second time to the provider? Tell me how that's working. Is there redundancy in that system, sir?
Yeah, there really is not. There is some basic work we would call intake on the DCS side around gathering the necessary information from the family to begin to work with them, establish their eligibility for 4E and TennCare. When you hear us talk about assessment on the provider side, we're really referring to those assessment centers and those assessment foster homes that we've built and developed. And that assessment work is clinical in nature. It's work done by qualified professionals who are working towards establishing or ruling out diagnoses and charting a course for treatment. That is work our staff generally do not do. We are following the recommendations of our provider community in consultation with our own mental health clinicians.
I will tell you that the federal government has not changed the requirements under 4E and the poverty levels. They've not reestablished the poverty levels for children since 1996. And it's something that when I was in DC in December, I talked about with our federal partners, with the other states, with the Trafficking in Persons Office. I talked to everyone I could find to talk to about it, because the number of children that we're able to serve and draw down 4E dollars for is shrinking year over year, because the kids who qualify under 4E is shrinking year over year, because the poverty level in 1996 is not what the poverty level is in 2006.
Final question, Chair.
Chairman Hall.
I fear that our private provider network is doing the same thing for early 2000s reimbursements. And I want to ensure that we continue to have a robust private provider network, as well as our kinship placements and all things in between. And I've heard anecdotally that there are concerns from private providers that reimbursements are not catching up with where they need to be. And I would encourage you to sharpen your pencil on that.
So I think we have been pursuing what we would think of as a level 5. I don't think that we're drawing down the maximum federal dollars for what we would consider to be the highest need kids, because it just doesn't exist, right? That level 5 doesn't exist. And so that's what we've been working on for about the last 18 months. That is what we have done a sort of survey research work around. Again, this federal poverty rate that has not been adjusted for children in 30 years is a major problem for the states, because the amount of money that we're drawing down under 4E is shrinking year over year, which means the state's paying more every year to serve the highest need kids. And that ought to be backwards. And it's never going to be popular to put more kids under poverty, but it should have been done every couple of years. We should have adjusted the poverty rate every couple of years, and we haven't. And now it hasn't been done for 30 years. And it's going to be a massive adjustment if it's ever done again.
Chairman Hall.
Chairman, I lied. I apologize. I've got one more question here, so I apologize. It kind of sounds like some of my colleagues up here, so I apologize. Final question, and turn my mic off after this, but transitional housing. Our Isaiah houses have been doing incredible work, but they are limited to the amount of time they could or should. They have been created in order to keep kids off of cots in offices, and Isaiah houses have done great. I'm hearing, again, across the state of Tennessee, the transitional housing is going from one move on the child's worst day of their life into transitional housing 72 hours later to somewhere else in transitional housing. And I fear that our network is not strong enough to continue that, and children are being moved multiple times before they find any semblance of permanency. That's all I've got, Commissioner or Chairman, and I welcome your thoughts.
And thank you for that question. It allows me to give you an update. There's been no child in an office since January 25th. We did take your comments to heart last fall, and we're working diligently on that. You're right, Isaiah Houses really work, their mission is to care for a child in the first 72 hours after they come into custody. Director Mix has worked very hard to expand the capacity through the network. The network has to flow so that kids move timely through the system when they need higher levels of care. If the capacity is not there in the system, then a child stays longer in a transitional home than they should. When we can keep the numbers at 20 or below, then they can move timely through the system. And that's where we've been really since Thanksgiving. The numbers are right around 20. In some weeks, they've been 10 or less in transition, which means they're flowing. They're flowing through the system, which is what they are meant to do. And so I appreciate your question, and I thank you giving me an opportunity to answer that. And we'd be happy to keep you updated on that on a regular basis.
All right, thank you. Next on the list, Chairman Williams, you're recognized.
Thank you. Thank you, Commissioner, for your hard work. Just wanted to follow up on the private case managers. In FY20, we started spending right here. We started spending about $31.3 million has gone to increasing our case managers. And then we started spending around $50.3 million for privatized or contracted case management since 2024. This proposed budget for the first time proposes $34.5 million recurring for private case management. We were doing it non-recurring before because we were trying to help our state employees to meet the need. This is the first time we're doing it with recurring dollars. So I guess my question, first of all, is why use state dollars in recurring method for private? What's better about private case management versus our own case managers?
I'm not sure there's anything necessarily better about privatized case management. This does effectively privatize about 25% of the foster care support work that would be done in the state. It allows us to convert the foster care support work being done into CPS, Child Protective Services. Child Protective Services with our department is the area of our department that cannot be done by contracted work. Foster care support, social services, that kind of work can be done by contracted work. Child safety, special investigations, that kind of work cannot be done by contracted work. We do not want to expand state government. And so in order to continue to reduce the number of caseloads to address the needs within the department, contracted state workers are the best way to go. If we continue to reduce the number of kids in custody, if the trend continues in this department, if we get to a point where caseload averages fall below 15 or 12, even in Child Protective Services, we can talk about reducing the number of the reoccurring budget in that particular area. It is much more difficult, I think, to cut state workers than it is to reduce the contracted reoccurring budget.
That may be the case if you didn't have 440 vacancies in state employees in your department. And so since January, we have that many vacancies. It seems as though our budget is built upon us doing the work, but we're doing it with private case management. I guess the question is, what is the comparison between the salary and benefits of a private case manager versus one of the state?
They're very comparable. The private provider case managers make a very comparable salary to state workers. I think there's not a lot of difference between what they make and what our case managers make. I will tell you that they do a great job. When I was out in Dixon last month talking to our Dixon office, I wasn't really sure how our case managers were going to react to, hey, we may be bringing on a bunch more private provider case managers instead of state employees. I was very pleasantly surprised. They were very excited about the idea of additional contracted case managers. I think they see this as this is going to help us continue to reduce the number of cases that we are carrying. And I think they're willing to take any kind of help they can get at this point. The vacancy rate for case managers is hovering between 10 and 12%. I don't think it's probably realistic to think we're going to ever be at 0 vacancies in our department. But I think a 10 to 12% vacancy rate for a department of our size is a healthy vacancy rate for our department.
So when I look at those vacancies, though, if they're getting paid the same, why are we having difficulty hiring people if they're paid the same to be a private caseworker versus one for the state? It seems like it seems like it would be the opposite. If you're getting paid more to be a private provider versus a state employee, that might make sense in order to do that. I guess the question is why would a private case manager not want to come work for the state and the benefits associated with the state if the pay were the same?
I think it's not that they wouldn't want to come to work for the state, and we don't have any problem hiring our case managers. We are fielding a class every other month of about 100 case managers. Since we went to the higher salaries, we have hundreds of applicants every time we post a requisition. So it's not like it was 3 years ago when our start salary was $43,000. We have hundreds of applicants every time we go to hire. I think that private provider case managers just seem to do a great job. They have been a great boon to the agency. They've been a great assist to the agency. I think they've had great outcomes for the agency. They're moving kids to permanency in the areas that they're working, in the hardest hit areas of the state. Our case managers have a positive response to this budget initiative. That was really my biggest fear. So we decided to ask for additional funding. We asked for both. We asked for case managers and we asked for privatized. And this is what we got.
Yeah. So with the number of vacancies and with us utilizing those private case managers, I wondered if the difference might be if the pay's the same, if maybe the caseload variant was different. What is the caseload for a private provider versus one of a state employee?
It's 20.
So they're the same.
They're the same.
So it does beg the question, if all things be equal in pay and benefits and caseload, it just is curious to me why someone would not want to be one of the 440 filled vacancies. It's a looming question in the back of my mind as we do this year over year, particularly if we're raising salaries. And so it does give me quite a bit of concern, particularly for those vacancies and then the turnover that we've experienced. I want to go a little bit different direction as it relates to those kids. We had a bill on the House floor, and it was purported that there were about 8,000 children in Tennessee that were available for foster parents for them to stay in their homes. Is that number accurate, or what would that number be?
We have about 7,798 children in foster care.
Mm-hmm. Okay, so for the number, do you have any idea the number of families in the state who have gotten a home visit and been qualified to be foster parents that are choosing not to be foster parents?
Answer that specific question as we sit here today, but about 5,800 of those 7,900 kids are placed in foster care. Tennessee has close to 4,300 foster homes. There are 1,509, as I sit here today, that do not currently have a placement. It's hard to draw conclusions from that. Families pause their work for various reasons. Mm-hmm. They adopt. They served a hard kid. They need a break. Mm-hmm. It's emotional work, etc. But that's roughly what the sort of empty home looks like currently.
Where, if you don't mind asking, where are those 1,509 children now?
Those are not children. Those are foster homes
Okay.
that are sitting there.
Okay. All right. I'd be interested to know if you could provide to me just a 10-year look back of the number of kids in foster homes, those not placed, and the number of homes that qualified to foster kids. The reason for the question is a follow-up too is how does Tennessee compare with the ability for the state to terminate parental rights as compared to our surrounding states?
Sammy? Identify yourself.
Good afternoon, Sammy Mayfair, General Counsel for the Department of Children's Services. So as far as our statutes, they're very similar to our sister states, our ability to terminate parental rights. In Tennessee, we have to prove both a ground for termination exists and that termination is in a child's best interests. And we have to prove both of those by clear and convincing evidence, which is a higher burden of proof. So that's what we are here.
But it's easy to say that we compare to our surrounding states as it relates to our ability to sever those parental rights. We're not different or have a higher bar.
No, we are some states obviously have nuances to their laws, and I'm not licensed in our surrounding states.
Yeah.
But our termination laws track fairly closely with our surrounding states. Yes.
Right. Anecdotally, the reason for the question is that as I talk to potential foster parents or those who've had a home study who may be tired, a lot of the determination of whether or not they want to continue to choose is whether or not that children will be permanently placed in their home through adoption. And so when the parental rights are not able to be severed or very difficult to do, a lot of parents, it makes it difficult not just to open their home, but their heart to foster parents. So I think it's important that we take into consideration all the things that are impacting that as it relates to foster.
So I think you might be interested to know that we have just begun a new permanency team. We have a number of long stayer children in the department that we feel like should find permanency. And so we've begun a multi-agency permanency team with partners from Youth Villages, Omni, the Administrative Office of the Courts, TCCY, and then a number of dedicated personnel within our department. And we're looking at about 800 children who've been in the system for longer than 15 months with no TPR and no reasonable efforts found. And so we're going to be taking a hard look at those 800 cases to try to move those children either back with their biological parents or into a TPR situation. But either way, those children need to find permanency as soon as we can possibly do that.
Thank you, Commissioner. Final question. Last year, we spent about $500,000 on a new program called Viable. Could you give us an update on that expenditure and what the progress is?
Yeah, I think that thank you for that question. So Viable has moved into the 2 additional regions of the state. They are on track to serve the number of kids that they propose to serve. Their outcomes are just what we would hope to find. As you know, I really like this program because they're working both with vulnerable youth as well as the businesses in those areas to prepare those businesses to hire individuals who either come with a trauma background or come with a lack of sort of what I call kind of an infrastructure or safety net. I think Viable does a tremendous job with vulnerable populations.
Yeah, I was really excited to see us spend a little bit of money there to see what the results are. I'm glad to hear that it's working well. Thank you. Thank you, Chairman.
Thank you. Next on the list, Chairman Gillespie, you're recognized.
Thank you, Mr. Chair. Commissioner team, thank you so much for being here. This question is about the relative care program. In 2023, $32 million recurring was funded to develop the relative care giver program, which provides stipends to relative caregivers who take custody of children who otherwise be at risk entering DCS custody. According to DCS reports, only 1.5% of children served through the relative care giver program went on to interstate custody. With that background, on the current this current budget hearing for the governor, you stated the wait list for this program was about 650 programs. But the questionnaire that you provided this committee on January 6th, that wait list grew from 650 to 996. Why is there a wait list for this program? And why did it grow by that much in that short of time? And I've got some follow-up questions based off your answers. Thank you.
Yes, sir. The program is capped at 32 million. The department doesn't have any additional funds to put towards that program. And so the wait list will grow. So once a child or youth comes off the programs, another child could come onto the program. So that wait list will continue to grow. It's one off, one on until the state either adds more money to that program or, again, it's a one off, one on. We did not elect to request additional funding for that program. This was really a sort of a legislative initiative. It was a sort of a legislative initiative. That's not to say that DCS wouldn't consider requesting additional funding in our next budget season for this, but it will continue to grow as long as there's no more funding for the program.
You're recognized, Vice Chairman.
Thank you, Mr. Chair. And you answered my two other questions. With that, I was going to ask just what the timetable was to establishing a prospective relative caregiver was the only question that I had left.
I apologize. Can you say that again?
How long does it take to develop or establish the eligibility for a relative caregiver under this program? Like from the time that they approach or you approach, how long does that process take?
I don't know.
We're all looking at each other because we don't want to speculate. But I mean, there is an application process where the relative caregiver will reach out to the contracted provider that's administering the program. They would fill out the application. They would determine whether or not they meet eligibility. So specifically, there is a relative caregiver program that provides services, and then the stipend is another component of that program. And so there is a separate eligibility criteria specifically for the stipend. So you may have a family that's receiving assistance through the relative caregiver program through, resource linkage or whatever that might look like that does not meet criteria for the stipend. And then once they've provided all of the qualifying documentation for the stipend, that is when they would go onto the wait list as it sits right now.
Okay, so I'm trying to get a better, or I think I've got a better idea of just how long the growth, we're capped at that 32.2 million until, if I heard you correctly, this body changes that, or is it federal?
No, it is all state funds.
Okay.
And so it stays at 32 million until you increase it or until we request an increase and you grant the increase. We knock down and you knock down quite a number of the eligibility requirements, the income eligibility requirements. This is a court, or like the courts are involved in this particular program. So these are children that are coming through the courts. There is some court action with this particular program. So this certainly is helping us reduce the number of kids that would have otherwise maybe come into custody. This is a really good prevention program for us, and it is keeping us, or enabling us to hold families together.
All right. Thank you so much, Commissioner and Mr. Chairman.
Thank you. Let's go to Chairman Williams. I think he has a follow-up question. Chairman Williams, you recognize.
Thank you. Thank you, Commissioner. Just wanted to clarify, a little bit confused about the answer. In 2023, we assigned $32.2 million recurring for the relative caregiver program, but on your website, it only says that we spent $12.625 million, a difference of $20 million recurring. Is there something that I'm missing that maybe is not being reported to where that $20 million recurring? Because even in the next year with the same $32.2 million, we spent almost $17 million in the recurring, in that recurring pool for the same relative caregiver payments.
Jim Lehman, Legislative Director, and I only know a little bit about this because we've been responsible for submitting the legislative report. So under the Relative Caregiver Program, we are statutorily required to issue reports by calendar year. So that FY24 was around 12 million. Fiscal year 25, it was around 17 million. And as of this most recent calendar year 25, it's up to about 21 million. We can't give away every single dollar in stipend payments. There is some amount of that Mohammed can speak to that is issued in payments to do the program to the providers and that kind of thing. So to coordinate the program, Mohammed could speak to that.
Mohammed Al-Kaisi, Assistant Commissioner of Finance and Budget. So the budget for the relative caregiver has two components, one for the stipends for families, and the other part is for case management that actually provided by private providers. So there is about close to $20 million for the stipends and the private providers, about $12 million.
Well, it seems like whether it's our providers or private providers, the reporting should be the same. I guess the reason why I'm saying that is over 3 years, we've allocated $96 million and we spent 41 of it. And so where did the $41 million go? Did it go to private case providers as it relates to relative caregiver program? I mean, the math's pretty simple.
Mohammed, do you want to speak to that? I know there was
Yeah,
a
I mean, I
ramp
can
up
speak to
time.
that.
Yeah.
The program in 2026, the program 2026 is expected to be fully utilized. The entire $32 million that would be utilized between the stipends and the private providers. In the previous years, the last year or 2 years, there was not full utilization to the program. So
Okay,
that's,
it's really difficult to understand that, particularly when we just said that we were provided the balance of the difference between the first year's $32 million was paid to private providers for the relative caregiver program. Now we're saying we spent $21 million year to date in this fiscal year, and that we automatically know that the balance of the $12.2 million is going to be spent with private. How can we possibly postulate that we're not going to spend any other revenue on the relative caregiver program for that's managed by state employees?
Andy Vrensky, Chief of Staff for the department. I think, what was it, Jim, 2 years ago, we had a legislative bill where we changed a lot of components of the relative caregiver program, which one was being income limits, which limited. So those first 2 years, we didn't have max participation because of the income limits. The second thing was the court order. And correct me if I'm wrong, Sammy, I think we had to have a finalized court order and we changed it to just a court order. So we were able to maximize all of our revenue at this point because of those changes we made.
Okay, so my assumption then is because of the change in statute that say fiscal year 25, of that $32 million, did you revert the other $16.5 million, or where did that revenue go?
It went into the custodial budget, probably.
Okay, thank you, Chairman. I may have further question later. Thank you.
Okay. Several folks still on the list. I want to look at fleet vehicles, and for last year, we appropriated $6.6 million to the department for 800 state vehicles. And of course, that's for the safe transportation of children. This proposed budget looks like $2 million to lease, and that'll be recurring, to lease 250 more. Can you tell me kind of the thought process behind that? Also, just curious how that funding flows. Does that go to general services and then flows over to the department, or does this go straight to the department? Just curious about that.
It goes to us. It comes to us and then it goes to general services. And our goal is to put a vehicle in the hands of all of our case managers for the safe transportation of children. You're correct, sir.
So what was there a study done that it's better to do that with the department, or just curious where that came from?
We didn't do a study, but all of our case managers have been transporting children in their own personal vehicles. The mileage that is accrued every month for our case managers is frankly astronomical. We felt like, and we did do a pretty extensive workup with General Services. And they actually came to us. They came to the department, I think a year before I came into the job, and said, hey, this would be a net neutral if you would put these case managers in state cars versus them claiming mileage, because their mileage is pretty extreme. And so we looked at it from two different angles. One is this is safer for case managers and kids. And two, this is a net neutral because of the mileage that they're traversing on our states on a daily basis.
So how many cars out of the 800, how many cars have been leased?
400.
400. Okay. So after you get the additional 250, how many more do you think you'll need? What's the number that you're looking at?
We have 2,200 case managers. We have 2,200 case managers. So we're slowly ramping up to that 2,200 number.
Wow. I would love to see the numbers that was ran on how much we were paying when our caseworkers, just to get a comparison, if we can
Yes,
do
sir.
that. Thank
Yes,
you.
sir.
All right, let's go to Representative Reeves. Representative Reeves, you are recognized.
Thank you, Mr. Chair. So in looking at first of all, thank you all for being here. I appreciate it. Looking at the budget, I see $2 million non-recurring for counsel and legal representation for complex litigation. Can y'all tell us why that additional funding is needed?
They control it.
Oh, sorry. Yes. So as you all are likely aware, the department is involved in multiple class action lawsuits at this time. And so that is recurring, those are legal fees to defend the state in those actions. There are specifically 2 class actions. And so it's not for DCS legal counsel. It is for outside counsel representing the agency.
And if you would, Mr. Chair, I'll just follow up to that. Is there a reason that you can't use the Attorney General's office to defend those matters?
So the Attorney General's office is also involved in representing us, but because of the complexity of the litigation, there are times when outside counsel is employed to assist the Attorney General's office, and these are both of those circumstances.
Okay, thank you. Thank you, Mr. Chair.
All right, thank you. Next on the list, Chairman Boyd, you're recognized.
Thank you, Mr. Chairman, Commissioner, and staff. It's great to see y'all today. So the question I have is on the juvenile justice centers. So the budget includes a total of 20 million non-renewing for miscellaneous appropriations for investments in infrastructure for a West and an East Tennessee Juvenile Justice Center. Do you have any details on those 2 initiatives?
So those are not in our budget, that correct?
For the detention centers.
Where?
They're not on ours. That's on we asked. That's the 10 million.
I know
Go
they
ahead,
are.
Chairman
They're not
Boyd.
in our budget. They're not in.
Yeah, I think
I'm aware of the request, but I don't think they're in our budget. Is that correct? I'm familiar with the request.
Yeah, we'll come back to you. Let Chairman Boyd. So we'll come back. Let's go to Chairman Baum.
Thank you, Chairman Hicks, and welcome, Commissioner Quinn. I've got a question about federal funding. In your budget, it looks like we're drawing down fewer federal dollars. Is this due to a change in federal policy, or is it due to a smaller population of children that we have that are eligible to draw down those dollars?
So I think this is probably mostly a question for the Assistant Commissioner, I will kind of also talk about, or kind of go back to my original statement of the federal government has not sort of reauthorized or reconfigured the federal poverty rates for children since 1996. Therefore, we are serving fewer and fewer children, are able to draw down 4E dollars for fewer and fewer children under that poverty rate. As you can imagine, the poverty rate between 1996 and 2006 has changed dramatically. And so fewer children are qualifying under 4E. And so, yes, we are drawing down less money from the federal government under 4E. And there are probably other drivers as well.
So let me elaborate a little bit more on this part. Title 4E.
Lean forward.
Sure. There you go. Okay. The main source of funding for the department from the feds is the Title 4E, which is an entitlement grant. The entitlement grant paid for three things. It pays for placement for children, particularly room and board and clothing, item like this, and also pays for case management. Even our staff case management cost, it's funded by 4E, and it also paid for administrative costs. So it paid a big portion of our cost. However, in order to be able to claim the federal funding for Title 4E, you have to meet the Title 4E requirement for children in custody. One of the main requirement is income requirement. So when a child comes to custody, we have to look at the family income that if it meets the federal requirement. And we are still tied to 1996 requirement, which is simply, I can just say, it's $1,289 a month for a family of four, $15,000. If you make anything above $15,000 for a family of four, you're automatically not qualified. So once you're not qualified, that means you can't get the cost for room and board. You can't even fund the cost for case management or administrative costs. So that becomes a very big issue for the department, not only for DCS, actually it's an issue around the entire country of loss of 4-year federal revenue every year. In addition to that, also with Families First regulation in 2018 and after, they added an additional requirement for children that are placed in residential facility. They have to meet additional requirement. Those requirements, the facility has to have accreditation. The program has to have 24 hours nurses. It has to be trauma informed. And the first 30 days, you have to have outside consultant to agree that the placement is appropriate. And then within 60 days, you have to go also to court has to issue that the placement is proper for the children. So there's a lot of requirement added since that additional requirement added in addition to the income. So combining all this together, states start losing 4E revenue, not just Tennessee. Almost all the states in the entire country is started to lose federal funding from 4E gradually. And that's why we actually requested a supplement for our federal side, is because we gradually start seeing decline in our ability to claim federal funding from 4E.
Okay, thank you for that detail. And I've got
I
one
appreciate it.
question about one of your expenditures. When we remove a child from a home because of suspected abuse, maybe suspected abuse by the parents, and the parents disagree and they appeal, they challenge that. My understanding is there's an internal appeals process that's the next step. Do we have many parents that appeal and use that process? And if so, how much are we spending on hearing those appeals?
So there's actually two separate appeals tracks, and so I want to make sure I understand which one you're wanting for. We do have an internal administrative procedures division, which individuals who have been substantiated as a perpetrator of abuse by our internal like the Child Abuse Registry. They can appeal that. They can also appeal certain subsidy decisions, and foster parents can appeal movement decisions of children from their home if the child is in place there for over 12 months. So that internal division is, we have a due process division who does an initial file review, and we employ 4 administrative law judges who actually have those hearings. There is a separate appeals process for the actual court process where we've removed a child from the home. Those appeals would go to circuit court, then potentially to the Court of Appeals, and even up to the Supreme Court. So we have a fair volume of people who take advantage of the Administrative Procedures Division internally. On the other side, on that court track of those appeals, I would say it's a steady amount of appeals. I wouldn't say it's an extraordinary amount.
Okay, and last part of that question, can you give me an idea of how long it takes? I mean, is this something that you can go through the appeals process in a week, and if you're found to be innocent, your child's back in the home, or is this something that takes months or years?
So on that court track process, I'm assuming that's what your question is asking. Depending on what level you go to, it can take a very long time. So the underlying dependency and neglect case, the rules are that you're supposed to have that adjudicatory hearing within 30 days of a removal. Realistically, in every county, that does not happen within 30 days because of dockets and a variety of things. Also, it's a very complex case. Litigation takes time. Typically, what we see if the parent exercises their right to appeal to the circuit court, it is a de novo hearing, which means it's a completely new trial. And so those typically take another chunk of time, so a few months at least, to resolve that hearing. If they do go to the Court of Appeals, that's an appeal on the record, and those take typically 6 months, sometimes more, before there is a resolution on that. And then obviously if it goes to the Supreme Court, there's even more time.
Okay, thank you.
All right, thank you. Next on the list, Chairman Hale.
Thank you, Chairman. Thank you, Commissioner Quinn and your staff. Couple of things. First of all, when we look at the budget, just an overall question, there's been some audit with the Comptroller's Office that has addressed many deficiencies and many issues. So could you kind of tell us as a committee what this budget does to address those issues?
Yes, sir. Thank you. I think that year over year, some of the issues that continue to plague the department are around caseload averages, casework and timeliness and response time. And so anytime we can reduce caseload averages and improve response time, free up case manager time so that we're doing the face-to-face visits that we need to do. When we do face-to-face visits, we draw down federal funds, to Representative Baum's point. So we need to improve the casework that we're doing. Thus, the request for the private provider case management. Residential custodial budget is about the timely movement of children through the system. When we can get children into residential treatment in a timely fashion, when we can improve our short stays in transitional homes, when we can get kids back out into the community, back into their community settings, they're better off. We want to make sure that we are returning children into the community. I've talked about our commitment to our real estate plan. We are fully committed to the real estate plan, fully committed to making sure that from a community-based standpoint, because we are building all across the state in our 6 regions, which is 2 regions in every grand region of the state, that we have opportunities for children to come into a setting that is purposefully built for children, that has medical and dental capabilities, clinical capabilities, and that we can serve them in a very intentional way in the communities where they are, so that we're not moving kids all over the state. We want to make sure that we have opportunities to serve kids in their communities. And so we think that our budget initiatives continue to enhance and support the continued initiatives that we've begun and continue to see. And we think those do address the comptroller findings.
Okay, so I guess when we look at surrounding states and stuff, it seems like we're on the high rate of children that's in group homes and things like that. You know, for our elderly, we want to keep them at home as long as possible. We don't want them to go to a nursing home. We don't want them in a facility or whatever. So it seems that we're pushing to institutionalize these children rather than getting them in homes and loving situations and stuff. And so I just, and looking at the cost of that, what's the cost per day if we're putting them in a facility and versus them being in a foster home? Can you kind of tell me what the difference is?
So I'm going to go back and talk about the story that I talked about in my opening and the Intercept model and the ability to use Intercept in the home versus sending that young person to a residential treatment. That young person in residential treatment is probably a $600 a day. And Intercept is $95 a day. And we do get 4E drawdown for Intercept because it is a clearinghouse program. So that's 95 less 40%. And that family stays together. Those folks stay in the home. Again, Intercept in the new 301 slots that we're utilizing Intercept in order to really draw down the number of kids coming into custody is already, in the first 7 months, we've seen a 12% reduction in those particular counties. And we're using for juvenile justice and we're using it for social services. In Bradley County, for instance, it's a 50% reduction in the JJ cases. It's a 33% reduction in Bradley County in JJ cases. And this is keeping kids in homes. So this is using Intercept to keep kids in home. This is not even foster care. This is Intercept. I would say that for kids who need to go into psychiatric residential treatment, they need psychiatric residential treatment, but we want to keep them in that setting only for the amount of time that they need to receive treatment. And then we need to have an opportunity to bring them back into the community, whether that's in a specialized treatment foster home, a medical foster home, or we can put them back in their home with a service like Intercept. We need to do that. But we need to have an array of options to bring them back into the community. But for children who need that specialized treatment, they need that specialized treatment. And it is about building out a network, as Director Mix talked about. We have to have that network for kids who need that high level of care. And then we need to be able to bring them home with the level of care that they need to remain in their home. That's our goal.
Right. So final follow-up to that, and it goes back to the story that you mentioned. So just as if you could kind of give us an idea of what just off of that Intercept program, what that has ended up saving the state with this program.
I'm glad you asked that because we talked about that before I came over here, and we don't have that exact number. And we talked about having that ready for the Senate budget hearing. Not that you all are not special.
Well, now that hurts our feelings.
You are very special. But we really just pulled the mega report for this first 7 months, and I want to look at both juvenile justice and social services, and I want to have this ready by say the end of the week to put this out to you, because when you're looking at JJ decreases, for instance, in cases, 53% in Rutherford County, 50% in Greene County, 35% in Hamlin County, 33% in Bradley, 13% in Shelby. In social services, 28% decrease in severe, 19% decrease in Greene County, 17% decrease in Hamlin, another 12% in Bradley, 7% decrease in Hamblin County. I mean, we're seeing these massive decreases, not just in foster care cases, because if we don't need to bring them into foster care, we don't need to bring them into foster care.
Right.
But we need to factor in, because detention is $200 a day. So this is a savings in detention. This is a savings in foster care. And so we need to work up those numbers. What is this saving us so far? And this is just the first 7 months. So this is thinking about the first 4 months, Youth Villages is hiring, really ramping up. And so where are we going to be at 14 months, at 18 months? I think the numbers are going to get better and better. We know that at 12 months, 94% of youth that go through the Intercept program do not return to custody. At 24 months, 88% of youth do not return to custody. This is an incredibly outcome-driven program. That's why we chose it.
Okay. Well, if you could get that information
Yes.
together and get that to Chairman Hicks where he could get
Yes.
that to the members.
Absolutely.
I greatly appreciate it. Thank you
Yes.
for the work you do. Shout out to Ms. Hayes because she is awesome, always very prompt. And
Yes.
so thank you, Chairman.
Yes.
Thank you. Representative Parkinson, you're recognized.
Thank you, Mr. Chair. And Commissioner, thank you for what you do, and thank you to your entire team for what they do. And Mr. Chair, do you mind? I want to go out of order for a second. I got a couple people in here that I need to recognize, if that's okay with you.
Go right ahead. You're
Okay.
recognized.
I thought I saw my county commissioner in here. Did he? I guess he got scared and ran out. But we'll come back to him. But also, I see Raymond Cheers, and he has an organization called Family Man Enterprises. He has a mentorship program called Family Man in Training. And he has some of his mentees here with him. So Raymond and the team and the mentees, will y'all please stand up so we can recognize you? Thank you, Mr. Chair. And I see my county commissioner, he came back in. This is my county commissioner, Charlie Caswell. I'm still raising him right now, but he's doing a really good job. And so y'all please make him feel welcome also. And Mr. Chair, if it's okay, I would like to ask a couple questions to the department. Commissioner Quinn, again, thank you and your team for all that you do. I look at your work as, work that is just as mentally grueling as that of being a police officer or someone in law enforcement. You see the stuff that we don't see, right? You live with it. And I think that's important for this body to understand too. It is not easy to do the work that you're doing when you see the worst of the worst cases when it comes to our children, and whether it's abuse, neglect, and abandonment, and a whole host of other things. So thank you so much for what you do. I do want, if you will, give me some clarity. If you can walk us through the level classification. So for children that come into state custody, so that we understand what those levels mean.
I'm going to let Frank answer that question.
Okay.
I assume you were referring to placement.
Yes.
So, yes, sir. So we have a spectrum of care for our young people. It starts out at its lowest level in kids' homes with services like Intercept.
Okay.
And then you move into traditional foster
What
care.
level is that?
Level nothing.
Level nothing.
Yeah.
Okay.
That child did not need to leave their home, and that's a good thing. Then you move into traditional foster care, both provider supported as well as with our agency. That would be level 1 foster care. Supervised independent living falls in that category as well. You move up to level 2. That's our first level of treatment foster care. It also includes some community-based group homes. And that's what that looks like out there. Level 3. Yes, sir.
You're moving a little too fast. So when you say level 2 and treatment, what are we talking? What kind of treatment are we talking about?
Yeah. So in terms of foster care, that is a higher level of supervision and clinical intervention. It's provided by our private provider partners who have expertise in this area. They provide additional training and support to both their families, and they coordinate those additional services for the young person.
Okay.
Move up one more level to level 3. You have another level of treatment foster care, which is similar to level 2, but ramp it up a little bit. You're also getting into higher level clinical community-based group homes. You're getting into our assessment center level of care. And at the very highest spectrum of that is the psychiatric residential treatment facility, which is a federal term, but it's a clinical RTC.
And that's still level 3?
That's all in level 3.
Okay.
Yes, sir. One more is level 4. That is a subacute sort of placement. It's for young people who have shown a propensity to be at risk of harm to themselves or others, but they are not currently meeting the criteria for an acute stay. Sitting adjacent to all of that is the hardware secure facilities for our delinquent youth. They don't really have a level per se assigned to them. They just are what they are. And I failed to mention in the level 3 level of care, there is a more community-based level of care for young people who are with us because of delinquency. It's still residential care, but we have options for that population as well.
Okay, thank you. And Mr. Chair, is it okay if I continue?
Yes, please go ahead.
Thank you, sir. What percentage, based on those levels, what percentage are going to the private providers versus that are staying in full DCS custody?
That's a tough question. So about 2,700 of our 7,200 kids in placement, because we have other kids in our care that are at home, are with DCS foster care. The rest of our population is served by our private provider community, both in residential treatment, group care, high intensity therapeutic foster care as well. It roughly breaks down across all the kinds of foster care. So to the gentleman's point earlier, about 74.4% of our kids are in families. They're not in residential treatment. They're not in group homes. They are in some type of foster care being supported by either the department or through one of our private provider partners.
Okay. And this I'm switch gears just a little bit. And this may be for the commissioner. You know, one of the things that I've been big on is the difference in the compensation for relatives that can take children into their care versus that of foster homes. Where are we in that regard now? Because the way I understood it, you have a child that needs placement that can go to a relative, but we were paying the relative that can take that child in a lot less than what we were paying a stranger that has a foster home. Where are we on that?
So I think there are a couple options. So we had the relative caregiver program that the legislature approved at 50% of the foster care board rate. That was a decision that was made before I got into this job. And then there's foster care, and then there's a kinship foster care. Any relative can choose to become a kinship foster parent if they wanted to receive the entire foster care board rate. That is always an option, and we can do an expedited kinship foster care approval process. There is an expedited process for kinship fostering.
But would that child have to go somewhere else before going to their relative before they get that? I'm assuming it's a certification.
Not necessarily. That process can almost take about 24 hours.
Oh, okay.
We can get that done pretty quickly.
Okay. Let me ask you this. What is the and you may have said this, there's been a lot of information exchange. What is the caseload currently for our case managers today?
Depends on where you ask,
Okay.
where you want to know.
Well, let's start within the department.
Well, again, it depends. It fluctuates everywhere all over the state, and it depends on what unit you're in. So social services, the average caseload is 17. Juvenile justice is 16.6. In-home and FCIP is 21.2. CPS is 29. The drug teams are 20.5 and human trafficking is 25. Those are the average caseloads.
Okay, thank you for that. That's a lot.
That's statewide.
That's statewide. Gotcha. Okay. Okay. And the caseworker vacancy rate, you mentioned that it was at what, 10 to 12%?
It fluctuates between 10 and 12%.
Okay. And so what's the retention rate though for these individuals that we're hiring? How long are they staying?
A point in time, it's about 15%. 15.
So clarify just a little bit if you don't mind.
So the national average is about 30%. The retention rate or turnover rate is about 15%. We are hovering at about 15 to 16.
Okay. And last question, the private providers, and correct me if I'm wrong, the private providers are the ones that are getting the children at our highest levels. Am I correct? Because they're not staying in-house, right?
That's correct.
That's correct. And so why are we not increasing the rate for those that are getting our I don't want to call them dangerous children, but our children with the most need, for the services that they're providing?
So I'm happy to respond to that. There is actually a rate structure that is commensurate with each of those types of care that I shared with you. That ranges from about $59 for traditional foster care a day by a provider agency up to a little over $700 a day for that subacute level of care. So that rate is commensurate with the needs of the child that is being placed. And so it's entire rate.
And those rates are approved by FRC.
I'm sorry, for the layman.
Those rates are approved by the Fiscal Review Committee.
Right, but it's based on your request, is it not?
Yes.
Right. So are we not requesting a rate increase for, those individuals those private?
Are you talking about a provider rate
provider
increase?
rate? Yes.
That was in our original budget. It is not in this current budget.
Oh, is this, okay, I got you. Okay, thank you for that. I got it. Okay, thank you so much. Appreciate it.
All right. Thank you. Let's go back just for a second, talk about the Juvenile Justice Center. So we know that $333 million is going to be used to build out 3 detention centers. That's going to be over the new Woodland Hills, a new John S. Wilder, and one over in Fayette County. And so TASER did a study and came back and said, when we look at pre-adjudication for those juveniles as we house them, they said the state should participate. West Tennessee needed something down there, so the state should participate. So therefore, in the miscellaneous section of this year's budget, there's $10 million for West Tennessee, $10 million for East Tennessee. What role will you all play in the detention centers? Not all at once.
So any juvenile detention center is subject to approval by the department, licensure if it's run by a private provider agency, or approval if it's run by a county government. So we will be involved once the facility is established in that monitoring piece.
Those juvenile detention centers, for the most part, are run by county government, similar to like a county government would run a jail for adult population, and TDOC would run the prison system. For the most part, it's either county governments, or juvenile courts, or private providers that run pre-adjudication detention. We receive the kids in post-adjudication, the juvenile justice youth.
Okay. Okay. All right. Let's move on to Representative Love.
Thank you, Mr. Chairman. Thank you, Commissioner, for your presentation. I did want to raise up an issue of concern that I had. I appreciate your reports, particularly the work you're doing around foster care and providing funds for those who may have difficulty when the child needs extra care and they can't necessarily work, and you provide funding for them. So I appreciate that program. I do have concerns, though, about a report from the Second Look Commission about the issues of drug use and some sex trafficking in these transitional homes. Have you put in place any measures to try to mitigate that and make sure that does not happen again in the transitional homes?
Yes, sir. I appreciate that question. I think those particular cases were from early 2023. So those are happened some time ago. I know that the case involving the potential drug possession was in an office. That was prior to us even going to a transitional home. And so, yes, I think we have learned quite a bit from those particular cases and put in place measures to hopefully not repeat those same issues.
Okay, thank you. If I could, one more, Chairman. Yes, sir. Thank you.
Yes, sir. Go right ahead.
And as we're looking at Disability Day on the Hill, do we have any programs that are intentional to make sure that as we talk about kids in foster care that may have disabilities, that they are intentionally looked at or taken care of?
Yes, I think we're actually have brought on some new programs.
We have done a significant part of our network building has been to address the large influx of young people with complex medical, intellectual, and developmental disabilities. My best number on that is 4 years ago, there were 100 of those kids needing specialized care. We have about 600 of those now. And through our partnerships with the Department of Disabilities and Aging and their network that supported adults, we've been able to accommodate the needs of those children and keep pace with them.
Thank you. Thank you, Chairman. I'm finished.
Okay, thank you very much. Next on the list, we have Representative Chisholm. You're recognized.
Thank you, Mr. Chairman. I also want to do a personal order. I want to give a shout out to Mr. Marshall Dotson, with Family Man as well, and the work that they do with mentoring and helping young men with skills that's going to last them a lifetime, which kind of leads into my question. So, community partnerships with local organizations, how do those organizations go about getting in contact with you all and working with you all?
So I think it depends on where in the state it is. I think we work through our resource linkage folks. We work through the community advisory boards. I think our partners with with TCCY help us bring communities together. They hold networking events to help us bring communities together. We would like to work as much as possible with our community based resources. I think anytime we can bring mentoring opportunities to bear with our young people, recruiting efforts for fostering families. I think one of the things that's been most promising about our foster care situation in the state is that our Every Child Tennessee efforts have enabled us to bring on volunteers to support foster families. So any kind of networking we can do amongst the community helps support and it doesn't just help us bring on more foster families, but helps us support foster families. So anytime we can network and engage with communities, I think we're better for it.
Thank you so much. Will someone be able to send me a resource guide so I can send it out to?
Absolutely.
Thank you so much. And thank you, Mr. Chairman.
Thank you very much. Next on the list, Representative Shaw. You recognize.
Thank you, Mr. Chairman. Thank you, Commissioner, and your staff for being here. And thank you for the communication back and forward to my office. I appreciate that. I heard you talking earlier about private caseload workers versus those that work for you that work for you state workers. I did want to ask you, do the private caseload workers get the same benefits from the state?
No, sir.
But they like working for you over and above those who get those benefits. I'm just trying to juggle that up. Why is that?
I mean, I guess you'd have to ask them. They prefer working for a private organization versus the state, and the folks that work for the state would rather work for the state. I mean, I've been a state employee for over 25 years, and I mean, selfishly, I have a pension. I think for those of us that came to work for the state when there was a pension, those folks want to continue to work for the state. They want to work for a private entity. I think there are benefits to working for the state. I think for those who work for a private entity, they like working for the private company that they work for.
Do they get the cars that you do? You furnish them the cars and all like you do?
No, sir.
They just, that's interesting. I'd like to do some research to find that out. That's really interesting, but thank you so much. Yeah.
All right, thank you very much, Representative. Let's go back to Chairman Williams for a follow-up.
Thank you, Commissioner. Utterly confused. When I asked you earlier about the caseloads, I asked you what the caseload was. I think what you gave me was the statutory requirement, which is 20.
Yes, sir.
Okay. And then when my colleague asked a moment ago about the different caseloads for each of the different groups, that they range somewhere between 17 and 21.7. With the same number of vacancies that we have now, what I'm trying to figure out is what the actual caseload, because back in your presentation to the governor back in the fall, you stated that there were some case managers that had 30, 40, or 50 cases that they had on hand. So maybe the best way to do it is to look at a little bit broader view of it. So what is the total number of cases that both private and contracted case managers currently have before them in the state?
So our private provider case managers are currently carrying approximately 1,600 cases.
So they have 1,600 cases.
Yes, sir.
And the state case managers, how many are they carrying?
I don't have the total number. I just have averages.
Well, we could infer if we knew how many total cases that we had and how many case managers we had in both private and public, we could at least get an average of what it would be. So we don't have to go based upon your testimony in the fall that some still had 30, 40, or 50. Obviously, if you're having 30, 40, or 50 cases, there's a high probability you live in a condensed geographical area, which allows you to touch a child every other day. Whereas if you're in Putnam County in the Cookeville office and you have 20 and yet they're in 7 different counties, there's no way you're going to provide the level of care and services that that child needs, whether you give them a car or not. So help us figure out what the actual total number of cases are. Surely we know how many cases, total cases we have open today in the state. Do we?
Well, what I've got in front of me are the averages, and
I get that, Commissioner, but in order to know the average, you have to know a total. Someone.
we're looking for it.
Okay.
Whatever his name is. Very long name. What's his name? I think it was two, something like that. But I'm not getting it. We think.
While they look, Representative Miller, do you still have someone you want to recognize?
Thank you, Mr. Chair. Mr. Chairman, I didn't actually have a question for the commissioner, but since we've been in these budget hearings, this has been pretty much the largest crowd we've actually had. And as I look out to my right, and I wonder, I see children out in the crowd. I'm not sure if the others are providers or are they adopted parents or who they are and who they represent, but I just want to recognize them and applaud them for sitting through these budget hearings. They wouldn't be here if they didn't care. So thank you, Mr. Chairman.
Thank you. Now back to the awkward silence.
Chairman, maybe while we're doing some math, quick math, the other number that I'm looking for is of the 3,840 employees that are state employees that are caseworkers, how many of the 3,840 employees are caseworkers? We know 1,600 people are private case managers. How many state case managers do we have of the 3,864 employees of the 4,200 that are, 4,200 that are budgeted for?
So the total number of cases as of January is 25,541.
Okay. And so we know we have 1,600 private case managers.
We have 95 private case managers carrying 1,600 cases.
Oh, okay. Okay. And so of the 3,840 state employees that are case managers, that are full-time positions, how many of those are case managers?
2219.
Perfect. And I am smart enough to use my phone to do some math. So I really appreciate that. It's just very difficult when even in the committee today, we've heard so many different numbers about the same subject matter, and then to look back at your testimony and that the number of employees or case managers hasn't changed, to be able to understand how we haven't hired anyone, but we did have some people with 30, 40, or 50. So somebody, if we have somebody at 30 or 40 or 50, we had to have some outliers in the other in order to meet the statutory requirement. And so the goal really is to find out what the total number of cases on average that both private and state case managers do, with the idea that if we're paying private case managers and they're getting the paid exactly the same way or the same thing, why are we paying a private company to do this? Or conversely, why do we have state employees doing this if the caseload is better managed with a private group? I did have one other quick question that I wanted to speak to. A private case manager, are they, how do you know they're not incentivized to elevate a case to a higher risk level because the reimbursement rate is better?
So they're supporting foster care work. They're supporting kids in foster care. They're not in child protective services. They're not removing children from custody. So they're not making decisions about children going into high levels of treatment.
Okay, so you're not concerned at all about a child being assessed at a higher level than what they might be if a state employee was doing it, because they're helping us draw down dollars at a higher level.
Yes, sir. There is also a procedure we have in place with our agency that provides the private provider case management. When there is a question, particularly if they might also oversee the placement agency, those come to my office for review and concurrence or feedback before any change occurs.
Approximately how many of those cases do you review a year?
Oh, very few.
Okay.
Once a month.
All right. Thank you very much. Thank you, Chairman.
All right, thank you. Members, I have no one else on the list. Department, thank you very much. Commissioner, thank you for your presentation, for answering our questions. And without objection, we are going to go back into session. We're back into session. And that does complete our calendar for today. Just a reminder that budget hearings will resume tomorrow, February 26, 2026 at 10 a.m. in House Hearing Room 1. Do we have any further business coming before the committee? 10 a.m., right after. 10 a.m. All right, do we have any further business coming before the committee? Without objection, we stand adjourned. We're adjourned.